Board of Commissioners' 10th budget work session. Commissioner Singleton is joining virtually this morning. Audience members, I want to start by asking you to please silence your electronic devices. For those presenting today, please turn your mic on when you begin speaking and off when you've completed your remarks. For all presenters, please state your name for the record before speaking or responding to questions. Today's budget work session is on the Department of County Human Services. And I would invite Interim Director Rachel Pearl and her team to come up to the front, including Interim Deputy Director Alexis Ashby. Good morning. Oh, great. And members of the CBRAC, yeah, please come on forward.
Brian. And everyone, all the folks.
Yes.
Yeah.
We want everyone here.
And
Good morning, everyone. I'll turn it over to you, Rachel.
good morning. I thought I'd start the morning off by waking myself by pouring water all over myself. So we're just because, I've got to break the ice somehow, so I did that. But good morning, Chair and Commissioners. My name is Rachel Pearl. I use she and her pronouns, and I'm the Interim Director for the Department of County Human Services. It is an honor and privilege to serve in a leadership capacity for the absolute best department in Multnomah County, alongside the most incredible leadership team and the dedicated staff who pour their hearts into serving this community. And of course, our community-based organizations who reach every corner of this county, providing critical services to the people who live and work here. So I just want to take a moment to thank each and every one of them, because we can't do this without them. So whether you are here in the room, because there's many people in the room with us today, or watching from your desk, I just want to say thank you. I'm grateful for you. I see you, and you give me so much hope for this world. All of these folks come together in excellence to support the people of Multnomah County across their lifespan, from birth to end of life, especially those who are most marginalized in our community. Whether that is completing over 1,700 monitoring visits to adult care homes and aging, disability, and veteran services, providing over 7,000 free preschool seats to children between 3 and 4 years old through Preschool for All, providing safety, trust, and belonging to over 16,000 school-aged children through SUN, preventing evictions for more than 2,000 households in youth and family services, serving over 6,000 community members who have intellectual or developmental disability designation in intellectual and developmental services, and providing direct client assistance to over 130 families through our Immigrant Resilience and Stability Program in our administration division. This department delivers year after year, and we will continue to do so no matter what. This past year, our DCHS team co-led the emergency response when SNAP funding was suddenly paused and when devastating immigration enforcement ripped apart our community. DCHS is there through it all. Our DCHS team and our providers model determination, resilience, a community-centered approach, and the belief in the true story that the people who we have the privilege to serve are the heroes in their own stories each and every day. We have the honor of walking alongside this resilient community, and we remain flexible, nimble, collaborative, culturally responsive, and we are always here and ready to show up to remove barriers that are in place so that people can thrive and reach the goals they have for themselves and their families. Next slide, please. This is an overview. I'm sure you've seen this slide a few times of what we'll cover today. We'll hear from our Community Budget Advisory Committee, and then we will provide an overview of the DCHS budget, our process and priorities, and how equity was embedded throughout. And we'll go through our budget by division to dig into the details a bit more. We will also cover some additional challenges at the state and federal level that are impacting DCHS that we will face this coming year. And most importantly, we will have time for your questions. Next slide, please. So we'll now have the opportunity to hear from our Community Budget Advisory Committee members. So I'll pass it to our CBAC Chair, Becky Graham, and one of our newest members, Ryan Rousser, who will talk about the CBAC process, their recommendations. And before I do, I just want to take a quick moment to thank all of our CBAC members for leaning in throughout the year, and especially during the budget process, asking really important questions, helping us think about our work through a community member lens, and taking the time to understand our department. And overall, I know that all of us are grateful for the way that you show up with compassion for this community. So take it away, Becky.
Good morning.
Good morning, Chair and Commissioners. My name is Becky Graham, and I've served on the DCHS CBAC for about 4 years now. Presenting with me today is one of my fellow CBAC members, Ryan Reiser. As you can see, we have an amazing mix of new and returning members this year, so we were very pleased and grateful for adding to our ranks and gaining new voices. I want to say a couple things up front. First, we recognize the difficulty in making tough budget decisions. DCHS does amazing work in our community, and it's hard to think of any of it going away. Second, as you know, the CBACs have a tight time frame with which to review the budget and provide feedback. This is particularly challenging in a department as large and complex as DCHS. We simply don't have time in a single 90-minute meeting to get through all the program offers, and formulate recommendations. Our strategy this year was to instead focus primarily on high-level observations that we believed were important. Next slide, please. We have 3 high-level observations. Number 1, we don't pretend to completely understand the county's internal indirect rate. However, we were dismayed to see that because DCHS has kept its administrative expenses low, I think the lowest of all departments, if not in all the departments, its indirect rate had to be cut by $2.3 million. And that came on top of the required budget reduction of $3.2 million. The loss in revenue from the indirect rate was over 70% of the required budget cuts. It seemed like a bit of a double whammy. We encourage consideration of this when looking at the overall budget reduction for DCHS. Also, given the county's move to centralize some operations, we hope that this rate calculation will be reviewed and modified if needed to provide the appropriate incentive to spend as much as possible on direct services. Number 2, knowing that budgets are likely to continue to be tight, we need better metrics with which to measure success. To be clear, let me briefly explain what we mean by better metrics. Define the problem we are trying to solve. Compare strategies. Think comprehensively. Look at trend lines and indicators of success. Establish goals that minimize unintended consequences. These are well thought out, non-binary metrics. They're really, really hard to do well, especially when you're measuring outcomes involving human services. But we believe an investment into them would pay dividends in the future. Number 3, due to the diverse backgrounds of our CBAC members and as a result of several site visits last summer, we discussed the toll that it takes on employees working directly with vulnerable populations and the importance of caring for and retaining those employees. We encourage the board to remember these employees in your budget discussions, not only to uphold the values of the county, but also to avoid costly turnover of staff. I will now turn it over to Ryan to talk about one specific program recommendation.
Hello, I'm Ryan Reiser. Next slide, please. So we focused our budget questions and discussion on what we believe were the programs serving the most vulnerable community members, as well as investments that could save money in the long run. I am the executive director of a local nonprofit, and as some of you may know from working together in the past on violence prevention work, that prevention is not only much more effective, but comes at a fraction of the cost to reactive services. One of the largest programs in that regard is eviction prevention. We know that it's not only better, but cheaper to keep people housed than to rehouse them. Prevention is key, and prevention lives with DCHS. We recommend that the county fully fund program offer 25133B.
Next slide, please. Oh, okay. I guess my final comments are just to do a couple of thank yous. Thank you especially
Can you
to my...
turn your mic on, please?
Oh, I'm sorry. Thank you. Final thank yous. First to my fellow CBAC members, especially those like Ryan, who jumped in literally in the middle of the budget process. To leadership and the entire staff of DCHS, who have been incredibly generous with their time and very patient with all of our questions throughout the year. To the Office of Community Involvement for recruiting and orienting all these new CBAC members. Their orientation sessions this past year were phenomenal. I went to them and I learned a lot, even though I'd been on a CBAC for a few years. And to all of you, commissioners, because I think I heard you say the 10th session, so I know you have sat through many, many hours of budget presentations, and I know that you're going to have a hard job working through some very difficult choices, so thank you for that work.
Thank you so much. We really appreciate the work of both of you, but everyone on the CBAC for the recommendations.
Yeah, thank you, Becky, for your steady leadership for our CBAC. We appreciate you so much. You bring such a fresh, insightful, and intentional approach to the work. We're very lucky that Becky shares her time and talents with us at DCHS. Next slide, please. So this year's budget landscape is defined by another year of reductions in county general fund, and DCHS also navigated a significant indirect rate reduction, resulting in an additional $2.3 million in cuts, which Becky mentioned and Robert will go into further detail around, and you will hear us mention it throughout our presentation because it's a significant impact for our department. This additional impact is a reflection of how lean DCHS operates from an administration perspective. We have continued to prioritize frontline positions over the last few years, and that has resulted in a lower indirect rate for us. We were also impacted by significant supportive housing services reductions. We lost $3.8 million in SHS for existing programming, but we did have $1 million in SHS restored as part of the ongoing $3.5 million eviction prevention funding. And I do want to thank you, Chair, for investing ongoing funds in eviction prevention for the first time since this program was launched in 2020. And in doing so, prioritizing families with children who are at risk of becoming homeless and keeping the Keeping Keys approach, which Alexis talks about and is a big part of how DCHS thinks about housing stability. The combination of reduction impacts for DCHS, the services that we provide, the wonderful employees who work for us, the providers we contract with, and the incredible people we serve is hitting us in a significant way. I want to provide a few details related to staff levels. While you will see information, oops, just kidding. I guess I'm all done. You will see information about vacancies in the appendix. It's important to know that many of those positions are actually filled by staff in temporary roles, like limited duration or work out of class. It's difficult to understand that when you're looking at lists of vacancies. We also have held vacancies to support Project SAVE so that impacted employees have somewhere to land. So that's just a part of that story. While we did take reductions in staff and our indirect impacts, we gained FTE overall due to growth in PFA primarily. So we are gaining 21 represented FTE and 2 non-represented FTE in the department. Our span of control is above 1 to 11 for the entire department, with ADVSD and IDD above 1 to 13, and our lowest ratio being in preschool for all with just below 1 to 7, but that's continuing to change as the program grows and we are bringing on a lot of represented employees into that space. Despite a challenging budget and future hardships on the horizon, DCHS continues to be an optimistic department. We believe in this community and the people who live here. We continue to lean into finding solutions, building relationships and partnerships where we can collaborate, centering innovation and committing to communication, engagement, and results, which I think we've demonstrated through our work with immigrant and refugees, through our work with the Medicaid 1115 waiver, through our work with the SPMI project. So there's many examples of how we're continuing to do that even during difficult times. Next slide, please. Grounded in DCHS's North Star, which is that in Multnomah County, every person at all stages of life has equitable opportunities to thrive. We prioritize our strategic work around the 4 pillars. Quality of life, DCHS strives to ensure all individuals are safe and have equitable access to basic needs and the independence required to thrive at every stage of life. Economic stability, through an equity lens, DCHS promotes financial security by providing rent assistance and eviction prevention, as well as preventing utility shutoff. Educational access and support, the department focuses on providing high-quality, culturally responsive educational opportunities to ensure that every child has the foundation for academic success. And diverse and inclusive systems. By leading with equity throughout our operations, the department maintains accountable systems that prioritize an inclusive workforce and equitable access for all. Next slide, please. On this slide, I'll talk about our budget approach this year. As I stated, we had multiple compounding factors that have increased the complexity of our budget. It can be generally misleading when you look at our overall operating budget of $543 million, but most of that is due to Preschool for All growth and not a reflection of our overall department impact. Understanding DCHS's budget is critical when discussing how we prioritize reductions. We have two divisions that are primarily funded by Medicaid. When we take county general fund reductions to IDD and ADVSD, we are then going to take a reduction in Medicaid match, which leads to larger impacts and reductions for our department and the services we provide. We have Preschool for All, which obviously has dedicated and restricted funding due to the tax revenue that is determined by the ballot measure. And then we have Youth and Family Services, which is where most of our county general fund is, and we still only have about 50% of county general fund in that division. This leaves very few programs that can actually take reductions to meet our constraint. This year, we engaged in early scenario planning to help prepare as a department, which ended up being very helpful since we had compounding impacts. As the safety net department for the county, our priorities include looking at critical services that this community depends on, like housing stability, including eviction prevention, domestic violence survivor advocacy, and providing access to food. Programs that allow individuals and households to maintain their basic needs as they work hard to provide for themselves in a very challenging economic climate. And we continue to lift up programs that serve those who are most vulnerable, our children, survivors, immigrants and refugees, and aging and disabled community members. As a part of our budget process, we completed a staff budget survey and a community budget survey. The community survey responses highlighted the following priorities: housing and basic needs, support for vulnerable populations, focusing on services for survivors of domestic violence, and support for people with developmental disabilities and seniors, and adult protective services, and in Youth and Family Services, highlighting SUN service system and youth stabilization and shelter and intervention for sex trafficking and exploitation. The staff budget feedback survey highlighted staff priorities that were maintaining safety net services for the community, minimizing redundancies in the department, maintaining services for immigrants and refugees, prioritizing DCHS staffing infrastructure, and the safety and well-being of clients. Alexis and I also held sessions with each division to talk about the leadership transition that DCHS is going through. As you noted in the beginning, we've got a lot of interim going around, and that requires a lot of conversation, communication, and support of our staff. But in addition to talking about that, we talked about budget as well and the impacts and gave people that space. So the feedback from the surveys and those conversations were incorporated into our decision-making framework. We looked at the county strategic plan, the HRAP, and the department strategic plan to ensure alignment with our goals and the ability to continue providing services that intersect with that vision. DCHS is a lean department with from an administration perspective that I've said like 3 times, so I'm just keep pouring that in there so you remember it. We've continued to prioritize public-facing frontline positions and services, so preserving our existing infrastructure and our ability to respond, support our employees, innovate, and find solutions to challenges in a highly complicated time as necessary. It was important that we did not make decisions that would create further indirect rate challenges for the department in the coming years. We prioritized vacant positions when making reductions to minimize the impact on the incredible staff who work with DCHS. And as always, equity was elevated and embedded in our process from start to finish, and I will pass it to our equity manager, Dr. Richard, who will walk that through with you. Next slide.
Thank you so much, Rachel. Good morning to you, Chair. Thank you for your leadership, Commissioner Moyer and Commissioner Brim Edwards. We acknowledge Commissioner Singleton and Commissioner Jones-Dixon in their absence. Once again, I'm elated to sit in front of you. This will be my 6th year as the equity manager for the Department of County Human Services. And I want to state unequivocally that even in the transition of Mohammed Bader, I want to thank Rachel Pearl for giving me not just a seat at the table, but consistently and constantly engaging with me, especially when we have to make decisions, recommendations, and suggestions around cuts due to budget constraints. So I'm happy that I'm always included and equity is centered in the life and evolution of the budget process in DCHS, juxtaposed to our DCHS North Star and the 4 pillars. As always, my goal is to strategically utilize the EE lens, equity and empowerment lens, through the life cycle and evolution of the budget process to ensure that right in the midst of immensely and vital and critical budget decisions that impact all Multnomah County residents who desperately need these services, that the equity lens is not only applied, but that equity is centered throughout that entire process. For the past 6 years, I've been fortunate and privileged to review every program offer in DCHS to ensure that, one, equity is centered in each program offer, that there's some alignment with the one county approach and strategic plan. This is done in consultation with the department director, the deputy director, budget director, and our division directors. Again, I'm proud that I, as the equity manager, can sit and review budget spreadsheets and provide recommendations as we together and collectively determine what happens in the face of critical cuts and constraints. I also take time to engage our Diversity, Equity, and Social Justice Committee. That committee is chaired by our Senior Equity and Inclusion Analyst, Arnita Tucker McFarland, and we definitely always want to engage our Diversity Committee at some point in the conversation about the budget. To my left, our Budget Director, Robert Stoll. I appreciate him because at least once or twice during the budget cycle, Robert comes to our Diversity, Equity, and Social Justice Committee, and he presents on the budget, and he answers questions about the budget. And again, we know how important that is when we're facing cuts and tough budget constraints. And I appreciate Robert for taking the time to do that as he is so very busy during this season. Next slide, please, slide 11. And, during the times of budget reductions, it is extremely arduous, when attempting to provide these recommendations and suggestions to continue to have the discussion of how the needs of diverse and ethnic communities are met. What was hard for me in this budget season is when I'm looking at spreadsheets and we're talking about cuts and when we're talking about budget constraints and we are this safety net. What was hard for me, just to give you a picture in terms of the day in life of an equity manager, I thought about clients who may not only be served by one division, but they're served by multiple divisions. And so this year, I know I can recall at least one sleepless night where I was up eating my favorite snack, bananas and walnuts, really trying to determine, as I was looking at a spreadsheet, what recommendations I would give to Rachel and what recommendations I would give to Alexis. But again, as we center equity, as we center the equity and empowerment lens, again, my job is to think of these engaging questions. Who is adversely impacted, okay? Did those who were impacted have voice and input? And Rachel, in a previous slide, spoke very eloquently to the fact that we got community input on this budget as well as the members of our CBAC. And I want to thank the members of the CBAC for their work as well. As I kind of look forward, I'm going to be having conversations with Rachel, Robert, and Alexis to determine if there are some earlier spaces in the budget process where we can get more community input from the individuals who were most impacted by the decisions, and then really constantly taking a look all year round with respect to not only who is marginalized, but how they're marginalized and situated differently in this budget process. Equity is so very important. As I sat in closing, I began to think even more about individuals who feel the impact, paying at the pump, decisions between groceries and medicine, rent or insurance. And my only hope is that next year, maybe, we can have a better budget season so that we can continue not just to support, but to expand that safety net to help marginalized individuals. Again, I'm just grateful for the leadership in DCHS, our interim director, Rachel Pearl, interim deputy director, Alexis Ashby, and my colleagues on the senior leadership team for allowing me an opportunity to engage in these very, very difficult and arduous discussions. And we just, again, we look forward, to a day when we might not have to come as we are now. But in front of us, we have what we have. And I'm just hoping that the ethnic and diverse and marginalized citizens in our community will be somewhat happy with some of the decisions we make today. Thank you so much. I appreciate it. I yield to my great colleague, Robert Stowe.
Good morning. Every year I have to follow Dr. Richard. He's a tough act to follow, but I appreciate it, Doc. Robert Stoll. I am the finance manager here at DCHS. Good morning. Good to see you all. If we can go to the next slide, please. We're going to walk through some high-level department numbers before we get into the individual division slides. This first slide here has some pretty big numbers on it. The first number you may notice is it says there is a $1.1 billion budget for DCHS. In reality, that half of that is the reserves, the contingencies, and the dedicated savings over in the Preschool for All Fund. So in reality, the operating budget for DCHS is $543 million. I believe that makes us the largest department in the county at this point, and our budget went up by $100 million from FY26 to FY27. As we unpack these numbers, we're going to see all of that growth is really contained in one division and one funding source, but we're going to go through those sort of piece by piece. Next slide, please. And before we jump into the individual fund slides, it's important to note that we did have one item that did greatly affect our general fund. As Rachel mentioned earlier, the indirect rate for the department dropped from 10.22% to 7.20 in FY27. This is a very large year-over-year reduction and resulted in a general fund hole of $2.3 million. That's before any additional general fund reductions were taken. This was $2.3 million right at the start. This was really due to cuts in admin back in the FY25 budget. Those cuts were to stave off program cuts back in that budget, but ultimately they have a downstream impact on the indirect rate that hits here in FY27. We knew this would happen, and this is where we see it.
Can I get an explanation of what led to the indirect rate drop? Is that the indirect, like as we define it, indirect rate that we charge internally, or is that grant-based? Like, I'm confused about what led to a 30% indirect drop and how that negatively impacted your revenue.
So this is the way I always look at it, and indirect gets a little complicated, so this is my sort of the way I look at it. It's a fraction in the end. So the numerator is admin, if you will. The denominator is the department, and we look at this in terms of staffing. So as the numerator stays the same or shrinks in this case, the admin, and the department stays the same or grows, that fraction gets smaller. So essentially that fraction went from about 10% down to 7%. And then what we do is we apply that percentage to our grant and fee revenue that comes back to us as general fund revenue. And so ultimately it shrinks the general fund of the department right off the bat, mostly because we have that fractional change, and then when we apply it in future years, we end up with less general fund. I don't know if that made any sense at all, but that's sort of the fraction that always pops up.
So it's the amount we're allowed to charge for indirect, and is that Medicaid dollars or general fund dollars?
It's the amount that we're charging on all of our grants and fees, including Medicaid. So, but it's not just Medicaid, it's literally all of our grants and all of our fees that allow for indirect. It's to recoup that admin cost to a certain extent.
Okay.
Yeah.
But that's not the indirect that DCA or DCM charges you per employee, correct? We're talking about what we can charge the federal government when we do for the grants or Medicaid, which is such a large part of your, but okay, so I'm separating two different indirects that I mixed together. Yeah,
And-
okay.
And internal service rates are different than indirect, because we have a lot of conversation
Okay,
about
I
internal
just
service rates, and this, and
Fuse
indirect
them,
is different.
okay, so
Yeah.
this is a funding coming into the county to your department issue.
Bingo.
Got it,
Yep.
thank you.
Yep. Good question. Next slide, please. This slide shows the year-over-year changes by fund. It makes it pretty clear where the growth in the department is coming from. As you can see, the general fund dropped about $4 million in total, or about 5%. The federal state fund is basically flat with less than 1% growth. That middle column there, that is what remains of the ARP funding. And in fact, it wasn't even the ARP funding, it was the interest off the ARP funding, which is completely exhausted for FY27. The far right column is the supportive housing funds that drops by about 2/3 and drops by about $3.8 million. And of course, that fourth column, that is the Preschool for All Fund, and we can see that increase by $110 million. So that is where the growth in the department clearly is. Next slide, please. This slide shows the growth of the department since FY19. The growth is significant, to say the least, but again, the growth over the last few years has primarily been based on Preschool for All funding. And in fact, the general fund for DCHS has dropped from $84 million in FY25 to $77 million in FY26, and it's down to $73.1 million in FY27. Next slide, please. This slide shows the growth in the department's FTE since FY19. There's a bit of a jump in FY23 due to changes in the caseload management formula from the state that added positions to ADVSD and IDD. Since then, the department's FTE has hovered right around 1,000 FTE with pretty modest growth in the Preschool for All division the last couple of years. Next slide, please. This slide shows the breakdown of the FY27 budget by category. As you can see, contractual services really dominates the budget and is nearly 2/3 of the overall total. This is due in large part to the slots in Preschool for All, which are charged as contractual services. If you were to look at DCHS budget prior to Preschool for All, personnel was actually slightly more than contracted services, but clearly that has changed dramatically as that division has grown. Next slide, please. And this slide has the 5 divisions for the department broken out. Preschool for All now is 50% of the entire DCHS budget, but is only 7% of the total department FTE. Conversely, ADVSD is 50% of the total FTE, but is no small division in its own right at $122 million. YFS is there at $88 million, and IDD is $47 million, but it has an FTE of 250. The administrative division, which includes all of business services, all of HR, and the director's office, is only 2.5% of the department's budget. And now I'm going to turn it over to Alexis, who will talk about that small but mighty administration division.
Thank you, Robert. Next slide, please. Good morning. My name is Alexis Ashby. For the record, I'm the Interim Deputy Director for the Department of County Human Services. Next slide, Tasia. So as Robert said, I get to represent our small but mighty administration division. We serve as the strategic backbone of the Department of County Human Services, directly responsible for advancing our vision and ensuring that our department's North Star, that every person at every stage of life has equitable opportunities to thrive, is woven into the fabric of everything we do. With a dedicated workforce of over 1,000 employees, our role is to provide the critical infrastructure and support systems that allow our frontline staff and program teams to deliver high-quality, equitable services to the community. From the Director's Office to Human Resources and Business Services, we manage the essential operations, including strategic planning, fiscal stewardship of our $453 million operating budget, and a trauma-informed workforce development that sustains our department's mission. We also continue to lead vital emergency preparedness through our Emergency Support Function 6 team, ensuring that even in the times of crisis, our most vulnerable community members are met with safe, accessible, and culturally competent care. Our work is not just about oversight, it is about fostering a culture of safety, trust, and belonging that empowers every DCHS employee to lead with grace and achieve our shared goals of the community that we serve. Next slide, please. So this fiscal year 27 budget is set at $13.8 million. It's an increase from our fiscal year 26 budget of $11.8 million that was allocated last year. This change is primarily driven by a strategic effort to enhance our departmental transparency and improve outcome tracking by moving the data and evaluation unit from our Youth and Family Services division to the Director's Office. So it's not a change in total funds or additional funds. It's really that strategic transition of that team. And that's an increase of 9 FTE. The team was a size of 10. However, because we needed to take the indirect rate into account when making our reductions, we did need to reduce 1 FTE, which was $142,000. This budget also accounts for further increases stemming from a 3.5% COLA. And then for information, you can refer to the admin indirect rate slides, which we will cover. Next slide, please. The DCHS administration provides essential operation and infrastructure support while maintaining a direct responsibility for client services. What this slide really shows is the intersectionality of how our department works with not only just our own focus areas, but the countywide strategic plan, as well as the HRAP 2.0. Our work is aligned with 22 measures across 6 focus areas in the countywide strategic plan, and we're responsible for 13 KPIs associated with the HRAP 2.0. The budget includes investments such as the chair's submitted budget to support the Immigrant and Refugee Family Resiliency Funds. So thank you, Chair, for that. This is an opportunity for us to reinforce the county sanctuary status, understanding that there's been increased immigration enforcement significantly impacting our community members. We have a program goal that 85% of individuals who receive services remain stably housed 12 months after receiving support. And for our Emergency Support Function 6 team, which is critical to the county's mission of community safety, our primary goal is delivering mass care, emergency assistance, and temporary housing. We lead and manage direct shelter operations, provide person-in-charge support, and engage the public through disaster resource centers and 211 referrals. We are recognizing that our emergency management teams are taking significant reductions, and so we are working in concert with them to identify strategies around facilities and logistics. And we are also implementing the Better Impact Management Platform to improve volunteer data and mobilization during activations. If you all haven't heard, Better Impact is live. Please talk to your family members, your community members about signing up. It's a life-saving support that we offer in the department. And then for fiscal oversight, we ensure that the success of our community-based organizations by efficiently managing the volume of DCHS contracts and invoices, guaranteeing timely submission to administer community services. We heavily rely on our community-based organizations to do critical work. And in fiscal year 27, we have a target of processing over 21,000 invoices. We continue to foster a culture of safety, trust, and belonging, ensuring that every DCHS employee is empowered to lead with grace and provide safe, accessible, and culturally competent care, particularly in times of crisis. And really, this is how our budget delivers overall. Next slide, please. In DCHS, we aim to create a workplace where every employee experiences safety, trust, and belonging, which is critical for retaining employees, especially those from historically marginalized groups or who identify as Black, Indigenous, or people of color. This commitment aligns with the KPI that you see here, Employee Survey Work Climate Identity, which measures the effectiveness of efforts to foster an inclusive and affirming work environment. The Department of Social Justice Equity Committee also focuses on areas specifically related to retention, which addresses the survey observations and increases these elements. And as you can see, on a 4-point scale, we are consistently meeting a 3.4 score. Next slide, please. Diversity is a cornerstone of our workforce, with 48% of DCHS staff coming from ethnically diverse backgrounds. This is supported by deliberate recruitment efforts such as filling knowledge, skills, and abilities positions to ensure our services remain culturally and linguistically responsive. Furthermore, DCHS remains dedicated to robust recruitment, retention, and professional development strategies that empower our employees. It's also worth noting that DCHS maintains an impressive average retention rate of 93% of our employees. This figure serves as a clear indicator of success and the impact of our current development and retention initiatives. Next slide. With all of our divisions, we have some challenges that we are looking at how to problem solve, and one of those is looking at our services and technology needs, which is outpacing our staffing and capabilities. So right now, we are engaging in an initiative that's moving DCHS from an ad hoc project-based structure to a governance framework, and this ensures that our IT investments and resources align with our mission of client services. Our focuses are on regulatory compliance. As you all know, we have many contracts that require specific outcomes and measures to be met, workflow improvements, building efficiencies across data and data access, and thinking about how we invest in the future, building new capabilities on long-term scaling. And then finally, enabling data alignment and access. A primary focus for us at this time is really resolving the data fragmentation across the department, which really has resulted in siloed systems and multiple databases, which really prevents us from having a full 360 view of clients. Our future state is to really remove that manual data aggregation and create an integrated data model. And then for federal impact in HR 1, everyone has heard of the One Big Beautiful Bill Act that was signed into office in July of 2025, which is a legislative package that really is, the purpose is to reduce federal spending and enact tax cuts, which significantly impacts Medicaid and SNAP benefits for many of the residents that we're serving across the department. Because of these stricter rules, we really have to take an intentional approach to resolving some of the challenges locally in Multnomah County. So we are currently working with our ODHS, our Oregon Department of Human Services, I will try not to do acronyms, partners, to really think about how we can do ongoing community outreach and engagement. We're also focusing on internal work groups to create operational changes as a response of HR 1 impacts. And then we're looking at managing strategic communications. Next slide, please. And as I talked about, we do have our emergency support function 6 team, but in addition to that, back one slide, please. DCHS plays a critical role in the county's coordinated response to severe weather emergencies and climate-related crises. We know that climate emergencies disproportionately affect vulnerable populations, including people with lower incomes, communities of color, and the unhoused. Our equitable emergency preparedness strategy prioritizes the most vulnerable, ensuring inclusive shelter and culturally competent aid. We're also enhancing our continuity of operations planning, as well as our cross-divisional operationalizing of emergency support and outreach. And then for our indirect rate, as Rachel and Robert have both discussed, we are really thinking about how to mitigate significant funding pressures. And this also does include the chair's budget of $1 million reinvestment to supportive housing services, which will provide critical outreach and rapid rehousing functions for our department. Next slide. So as discussed earlier, DCHS did experience a 3.02% indirect rate decrease, which required us to make reductions across all divisions before the county general fund reduction, including our administration division. This resulted in the reduction of 2 FTE, 1 from our business services team, and then 1 from the data evaluation team that I talked about earlier. Next slide. And program offer 25004 is a one-time only request. This represents a strategic evolution from our original efforts, which primarily focused on the initial placement and resettlement of newly arrived families. While those earlier programs were crucial in addressing immediate housing and integration needs, the landscape of challenges facing immigrant families has fundamentally shifted. Our program has evolved to meet the critical current needs of clients and families facing increasing instability and complex crises. And so the primary focus now is providing direct client assistance to bolster family resiliency and ensure stable housing. And with that, I will pass it to my colleague, Irma.
Thank you, Alexis. Good morning, Chair and Commissioners. My name is Irma Jimenez. I use she, her pronouns. I'm the Division Director for Aging, Disability, and Veteran Services. Thank you for having us here today. I'm excited to share a glimpse of the amazing work that our ADVSD team does for our community every single day. Putting this presentation together got me, can you hear me?
I'm sorry, y'all. Chair, can we pause after each division? This is a long presentation to wait till the end for questions.
Absolutely, yeah. So why don't we go ahead and see if there are any questions on the administrative, and then we'll get right back to you. All right, Commissioner Singleton, if you have questions, please go ahead.
Thank you. I was just curious on slide 25, it brought up a question for me of how many different data systems you're using, and if you could talk a little bit more about the Infotech data integration project and if there are specific costs that are already covered or needed for that.
Thank you for the question, Commissioner. So we have 30 separate data sets in aging alone and programs that we're monitoring and staffing. And so if you think about just in that division, we then have to add aging, our IDD as well as YFS data systems. And so there's at least 40, I would say, separate data systems that we're trying to align. And there's already funding that's allocated to the work that we're doing with Infotech, and we're working alongside our IT teams to really identify what our future state will be for these projects. And right now we're in the project development phase.
Thank you. And will the goal of part of that being that people have line of sight if they're case management or doing services for somebody, they'll be able to see if they're connected to somebody else, or is this all happening outside of the existing 40 data sets?
So the end goal is to get to a place where we have a 360 view of the client so that no matter what door they're entering or what service system they're engaging with, we can identify across the system where they're also being served, with the additional goal with going more upstream and conducting predictive risk modeling and helping to provide preventative measures much early on in individuals' lifespans and situation and potential crises.
Thank you. That's helpful.
Can I ask a clarifying question on that? Is that data sharing just within your department, or is it multi-departmental?
Currently, it will be within the department.
So I'm sorry, I'm going to go back to slide 11. But I think it's more of an overarching question. So this is the equity slide, and it has the 5 Ps. And I'd love that there's talk about the data and how we're looking at how it impacts on individuals, and also, how are public resources being distributed geographically. Do you have the data about, with the budget you're presenting, how that impacts the disaggregated groups, including geography? One of the reasons I'm interested in that is some of the other departments are proposing pretty significant cuts. So for example, let's just say homeless services, a lot of shelters being closed in Southeast. And so I'm curious about how you all are seeing your services and where they're distributed. So is that data you could provide, so disaggregated race, ethnicity, geography, age, whatever else, however else you assess it?
Yeah, thanks, Commissioner. So, I mean, I think it depends on, these cuts are across many different programs, and it kind of, as we know, we do capture that data essentially across the board. Oops, I'm talking with my hands. And so, for example, that thought process and decision-making, I think we shared some of that with you around some of our reductions that impacted, youth and families. And then also we capture all of that related to eviction prevention as well. And so we can provide what we have, but whether or not it's, we can talk further and provide additional data about where we generally are offering services now, whether or not we can completely predict where the shift will happen and how this will impact that general service level in geographic areas into next year is the part that I'd want to get back to you on.
Okay, yeah, I'd be interested in what you have. That was places, for just using that as one of the examples. Place was one of the areas where the department stated that you're looking at how they distributed geographically, and I just said, okay, the SUN program. So again, there's cuts in some of the Southeast SUN programs, and then sort of how it layers on top of each other. So whatever you have, I'd be curious to see. And again, if you have race and ethnicity disaggregated as well.
All right, any other questions on administrative or the overview? All right. We will turn it back over then.
Okay. 29, I believe is slide 29. Yep, there we go. Hello again. Hello. Good morning. Irma Jimenez, Division Director for Aging, Disability, and Veteran Services. Thank you for having us here today. I'm excited to share a glimpse of the work that our amazing ADVSD team does for our community every single day. As I putting this presentation together, got me reflecting on my time here with the county. In this past December, I reached a milestone of 30 years. And all of those years here in this division, growth has been significant over the years, especially the last 30 years with many changes. So my passion for this work and the incredible ADVSD team still drives me to show up every single day. So I just really want to thank the staff, our providers, our community-based organizations for their resilience, their commitment, and showing up to serve our most vulnerable community members, and I am truly honored to lead this dedicated team. So, as the state-designated area agency on aging, ADVSD serves a critical role in Multnomah County. We serve over 60,000 community members across the county, including older adults, people with physical disabilities, and veterans. Our fundamental mission is to ensure that our consumers can live as independently as possible, directly improving their health, well-being, and quality of life. Next slide, please. This short video showcases our adult care home program. So Multnomah County holds a unique state exception allowing ADVSD to locally license care homes for older adults and individuals with physical and behavioral disabilities. While licensing for the intellectual and developmental disabilities recently transitioned to the state, ADVSD maintains its local oversight for these specific adult care settings, unlike other regions where the state manages all licensing. This local control allows us to set high standards for our community. A 93% overall residential satisfaction rate in our most recent survey demonstrates the positive work that this program does. So I think we show the video, please.
It's very important when you come in to feel like the home setting environment. That's the goal. doing exactly what I would do for my parents. That's how we take day by day. And every day we ask them, what would you like today? Like, how I'm gonna make your day better?
Even the caregivers that we get here, you know, whoever we have here, all what they need is love.
Like an ordinary home where our clients are treated like family. And they are all treated the same despite they have different care needs. Those little things are gonna make their days the best.
We got a lot of positive energy in this house. This is like a home. It feels like a home instead of like a facility.
This work, nobody forces us to do it. When you want to do it, please do your best and they're human beings. Take care of them as there's no tomorrow.
It's natural. I don't feel like I'm working. We respect their dignity, we respect their privacy, and we try to make them as much as possible independent.
Thank you. Next slide, please. So ADVSD runs 31 unique programs embedded within 5 major service areas. This comprehensive approach is how we meet people where they are. We connect residents to essential supports through our long-term services and supports program, providing access to food, medical benefits, case management, and long-term care. We also provide critical safety oversight through our public guardian, adult protective services, and adult care home programs. We also deliver key services through our Older Americans Act, which offers assistance like home-delivered meals, housekeeping, transportation, and health promotion programming, mostly through 16 contracts with community-based organizations. And we also ensure that veterans and their families are connected to the benefits they have earned through our Veteran Services Unit. Next slide, please. So on this slide, you see the summary of ADVSD's operating budget and FTE. We are mostly funded by a complex mix of county general fund, federal, and state dollars. The total fiscal year 27 budget is approximately $123 million, representing a net increase of about $1 million over the fiscal year 26 adopted budget. There is a small supportive housing services reduction. That's approximately $124,000 of direct client assistance. Our state and federal increases is due to our growth in our Oregon Project Independence Medicaid program and COLA adjustments. And as far as our county general fund, I'll speak about that in more in depth later in the presentation. You'll also see a 6.2 FTE net decrease between fiscal year 26 adopted budget and fiscal year 27 requested budget. And then although this net reduction is 6.2, there is a reduction of 19 FTE for fiscal year 27. So the difference between the 19 FTE reductions and the 6.2 net decrease is primarily due to a number of FTE that we added during a budget modification in fiscal year 26 that's not reflected here on this specific graph. And I'm happy to provide you with the details after this presentation. Next slide. So the fiscal year 27 approved budget ensures that ADVSD continues delivering critical services to the community, focusing on 3 main areas. First is our community presence. We will maintain a robust community presence by participating in 50 outreach events for underserved populations and conducting over 21,000 direct staff meetings with participants. This essential in-person work includes long-term services and supports home visits for assessments and care planning updates, adult protective services field visits to complete abuse investigations, public guardian assistance for consumers attending necessary appointments and monthly monitoring, and the adult care home inspections for licensing, monitoring, and compliance. Our direct service, we are budgeted to assist more than 60,000 people in long-term services and supports across 5 branch locations, enabling them to maintain their independence, improve their health and well-being, and access vital resources. Furthermore, we will fund our community partners to serve 470,000 meals to older adults. A part of our mission is protection, so with our safety and wellness, we will investigate 3,250 reports of older adult abuse and neglect and provide legal guardianship and protection for 140 incapacitated adults who are at risk. Next slide, please. So on this slide, I want to highlight the Aging and Disability Resource Connection, or the ADRC. This is a critical component of our division. It is the helpline and website that acts as the single front door access to our programs and community benefits. The ADRC is a central entry point, operating 24 hours a day, 7 days a week, and fielding contacts across phone calls, emails, texts, and in-person visits. It serves a vital safety function, answering after-hour calls for our programs like the Public Guardian Office and Adult Care Home Program. So our key performance indicator on this slide is the total contacts to the ADRC helpline. The significant increase in the total contacts for fiscal year 25 was driven by ADVSD bringing all after-hours, weekend, and holiday services in-house rather than contracting them out. And the drop in the number of contacts from fiscal year 25 to 26, I really want to stress that this decrease is actually a positive indicator of process efficiency, not a drop in a service or need. So the change is due to a process improvement in long-term services and supports. Previously, a client might have to leave like a voicemail and receive a callback, counting as 2 or more contacts. Now, the long-term services and supports clients are being connected directly to the ADRC specialist, which registers as only 1 contact. Next slide, please. So our challenges and our responses. The first one, Alexis talked about the HR1 impacts earlier. This is impacting ADVSD directly. So federal policy changes under the HR1 are creating a systemic risk for our clients, starting in reinstating work requirements for SNAP and increasing the frequency of Medicaid eligibility and renewal checks. So this is not just an administrative issue. It threatens to directly cut benefits for our most vulnerable populations. For instance, it narrows eligibility for immigrants with official humanitarian protections, including refugees, asylees, and survivors of trafficking, leading to an expected loss of SNAP benefits for an estimated 3,000 Oregonians, many who are older adults, children, and people with disabilities. The increased frequency of checks will go up to every 6 months. For many, this does pose a significant procedural risk, particularly for consumers experiencing housing instability who are likely to lose coverage simply by missing renewal paperwork deadlines. So we are really focusing on strict compliance and mitigating client loss. This involves intensive LTSS staff training on the new rules, co-developing resources with our community partners, and actively promoting the ADRC helpline to help community members navigate these complicated changes. The service need is also outpacing our staffing levels. Our operational model is strained because the state work model used to determine staffing needs has not been updated since 2020. This means rising local service demand is consistently outpacing our authorized staffing capacity. This imbalance forces us to reduce specialized positions, limit innovative service development, and rely heavily on creative measures like limited duration positions and overtime to cover required work. Our internal response is focused on maintaining minimum compliance and improve efficiency where possible. We're partnering with nursing facilities and hospitals to fund some positions and actively looking at business functions to streamline operations. And of course, our Medicaid match funding, due to the reduction in the county general fund for our indirect reduction, we are facing a substantial loss of $1.7 million in Medicaid match funding. This reduction compromises our ability to leverage federal dollars, which are essential for maintaining core services. And I'll provide more details in the next couple of slides. We are actively advocating for a state funding model that more accurately reflects the service needed in Multnomah County, and collaborating with the Oregon Department of Human Services leadership and the Oregon Association of Area Agency on Aging to find solutions and preserve critical capacity. And as far as our data access, I know Alexis spoke a lot about our data issues earlier. A persistent operational challenge is the need to navigate 30 disparate data sources in ADVSD for service tracking and mandatory state and federal reporting. This fragmentation increases administrative overhead and slows our ability to respond quickly to service gaps. For example, in long-term services and supports, a service case manager may have to navigate at least 10 databases to perform their duties. And in the Adult Protective Services program, screeners navigate up to 12 databases to complete one screening. So we are focused on advocating for and collaborating with IT, division level and department level to develop integrated data solutions while continually analyzing our business functions to improve efficiency and how we collect and report data. Next slide. So we had a lot of impact from the indirect reductions. So the total impact from the indirect reductions across the next two slides is almost $3 million, 2.9, and 12 FTE. These cuts primarily impact our ability to leverage and acquire Medicaid match funding, as I stated earlier, leading to a systemic capacity loss in mandated services. We're seeing a lot of impacts. There's an impact on safety oversight. We see a combined loss of 4 FTE across 2 vital safety programs, the Adult Care Home Program and our Adult Protective Services Program. And there's also an impact on our long-term services and supports of 5 FTE. This reduction directly impacts our capacity to provide critical case management to the 12,000 individuals in long-term care, and we lose staff dedicated to helping consumers with both Medicare and Medicaid successfully navigate their complex health insurance. Next slide, please. We're also seeing an impact on contracted services. A total of $163,055 of pass-through funding has been reduced in contracted services, which includes a $79,334 reduction program offer 25036 to a homeless services provider, which is impacting older adult care needs for 30 newly housed older adults. Next slide, please. So if this is the only cut we had to take, that would have been wonderful. But regarding the county general fund reductions, ADVSD initially proposed an $811,000 cut that would have eliminated vital housing and eviction prevention services for over 800 individuals in our safety net program. Because this program relies mostly entirely on county general funds, these were difficult trade-offs to consider. However, I do want to extend a thank you to the chair for preserving the majority of this program by reducing the cut to only $100,000. We are able to maintain our full staffing levels and minimize the impact to this program. So thank you, Chair. Appreciate it. So this concludes my portion of the presentation. Again, thank you for your time. I'll take questions, I guess. Right?
Thank you. Yeah, we'll do questions now at the end of the presentation. I will say there was a comment from the audience that it's been a little hard to hear commissioners, so please just make sure to be close to your mic when you are asking your questions. Thank you.
Go ahead. Okay. Talking about the impact of HR 1 and the need to, excuse me, recheck eligibility every 6 months Is there an anticipated increase in staffing that we will be getting from the feds via the state? Like, that's like an increase of like a third of the workload. Do we anticipate any additional funding?
We hope. We haven't been told that we are going to get an increase at all. I know that the state is working on the workload model currently, and hoping that they're taking that into consideration. I think the only thing that we have heard in this last legislative session was we will receive some positions for lead workers, and that's it.
Yikes. And have we heard yet who will be, in the federal legislation, there's language that says that there are individuals who are exempt from the work requirement. We still have to do the eligibility, but the work requirement. Will that impact the long-term care side of Medicaid, or is that purely the Oregon Health Plan?
I believe that is only the Oregon Health Plan. Do you know?
Okay, great.
Commissioner, I just want to answer that a little bit more extensively. So any individual who is enrolled in Title 19 services, they could be receiving OHP Medicaid or any other funding source. If their Medicaid redetermination doesn't occur and they lose their benefits, it would impact their long-term services.
Okay. And then they, excuse me, on the OHP side and the work requirement, have we gotten clear guidance about people who are exempt due to disability, the definition of disability?
I do not believe we've gotten a definition of disability yet.
Okay.
And the Medicaid work requirement began in January of 2027.
I love the amount of time they're giving us. On the state staffing model, are they still on a biannual basis readjusting, even though they're using an old model? So are we expecting, not this year, but next year, to have a look at our caseload and either add or subtract? It's not this year, right?
It's every 2 years, and I believe it's 25 to 27.
I was just going to go back to your other question about the, impact and workload related to HR 1, that the state did allocate $111 million, and we've been told there's around 300 positions, but we're not sure if any of those are coming outside of the state employee positions. So they are allocating something unclear, but just so you're aware that funding has been allocated and decision-making around it has not been shared with us yet.
Okay. On the reduction list, program offer 25023, which is ADVSD long-term services supports Medicaid, is that the MMA positions?
Mm-hmm.
Can you explain what that issue, what those positions, why do we have positions dedicated to navigating people who are dual eligible Medicaid, Medicare?
Well, that is, those are some positions that the state had funded previously. I think from the research I did, I believe like in 2006, they reduced those positions statewide, and ADVSD, kept those positions on. But it is something that the state had as like their model to do, and then reduce that, stop doing it, and then we continued to do that. We thought it was obviously, helpful for our consumers.
But what do they do?
So they help folks navigate through. They help them with prescriptions to make sure that their plan is the best plan for them according to the prescriptions that they have, because some plans will cover some prescriptions, some plans will have some co-pays for some prescriptions, so they kind of help them navigate like which plans they're going to choose for that, and they do some choice counseling on which plans are best for them.
Do they also help with like coverage and billing issues that consumers face?
I believe they do work with the CCOs pretty closely, and they do navigate some issues folks have for their plans.
If these positions go away, who will help troubleshoot those issues? Or is that just not going to exist?
It'll get absorbed by the case managers, maybe some through our ADRC helpline. And so it would be, it would be most of it would go to the eligibility workers.
Okay.
Which don't have a lot of time to even do 6 months of redetermination. So.
And that receives a pretty high Medicaid match rate. Is that because it counts as a service?
Yes, it's part of the case management role, so that we do get match for those positions, or are able to use match for those positions.
Yeah. I'm worried because, the disproportionality of the cut versus what we save when it's a Medicaid matched. Yeah, and, there are different match rates for different things. That one gets a particularly high match rate, so we're really losing a lot of service for not a lot of save, which I would also say is true for things like adult protective services and other areas.
I think I'll just say that all these cuts are hard, and we feel this was a really challenging process for us. I think for ADBSD, having to look at what's required from the state and prioritizing positions that are aligned with what we're mandated to do, which is like a difficult decision. It's not that we don't value those positions, that service, but that's just to understand our decision-making around prioritization of positions. But it's been really challenging because we recognize that we would like all of these positions to continue and to provide those services.
Can I ask a question about the guardianship program? We're serving 140 individuals, protected persons. What is the need? Are we meeting need? Is there always a wait list? What's the balance?
So I don't know if we're meeting the need. I know that there's a lot of work that's being done when we do get a referral to try to triage, give folks information. There's a lot of education that goes there as well. I would think that we would still, I don't think we have like we don't have like a wait list, but we do talk to, or that program does get a lot of questions and referrals that sometimes are not able to take some of those consumers.
Can I ask just follow up kind of on that? So I'm looking at the program offer 25024. And there's the reduction of the 2 FTE, which is also I think reflected on slide 36. So when I look down into the performance measures, the number of adult protective service intakes, it's been reduced from the FY26 estimate of 10,000 to 9,800, and then investigations completed. The measure goes from FY26 estimate of 3,550 to 3,250. Is the reduction in the target based on that you'll have less FTEs to, like you'll still have the same incoming referrals, but fewer FTE to do intakes and investigations? Or are you actually predicting that there will be fewer referrals?
I believe we're predicting that there are fewer referrals. So, I'm not sure of that detail.
That's okay, it's really a specific question, but I would love to know the answer.
I phone a friend here.
Yeah, I have my.
I mean, it's one thing if we think there's fewer referrals, because then it's like, maybe this is a right sizing, but if we actually, we have fewer FTEs, and that's what means we'll have fewer intakes and fewer investigations.
Yeah, I'm Brian Hughes. I'm the Senior Manager for the Adult Protective Services Program. Yeah, the reduction of 2 FTE would be, those are support service positions, helping people get restraining orders, transportation to medical appointments, accessing food boxes. So those reductions don't impact the number of intakes and the number of staff available to do investigations or screen the intakes.
So this would be more that you're assuming there'll be fewer intakes and fewer investigations completed. I think what I heard is the FTE are not related.
Correct.
To the intake or the investigations.
Correct. The FTE are not related to the number of intakes or the number of investigations completed. I think, yeah, it does show a slight reduction there. Yeah, like I said, that's not related to the FTE reduction. So
Obviously it would be.
It's just in anticipation.
Obviously it'd be great if there were fewer referrals and fewer need for investigations. That's a good answer if that's what the actual answer, if that's what it is. So if.
Yeah, I think it lines up with the FY25 actual. Our estimate for
26 was high?
26 was a little bit high, so.
Okay. That's an okay answer.
Yeah.
I'd like to have fewer investigations.
Sure. We all would.
Yeah. I mean, because there's less need, not because we've cut.
Correct.
Okay.
Sure. I mean, we will have a conversation and get back to you if there's like additional information. I think that the piece that we have talked about significantly with these reductions, even when it's a required service or something that we're not going to not support someone. However, when we have less support staff, it may take longer. And I do think that might mean that we can't complete the same number in the fiscal year, that there might be delays and it might take longer. So there's multiple impacts. Not that we would not complete an investigation or we would turn someone away. That's not what this team does. However, there may be delays that impact that. So we're going to have to continue to have those conversations. We can't do the same level with less positions, and there will be delays and impacts if we continue to see reductions to these programs. Doesn't mean we'll say, sorry, we can't help you. It might mean that it's going to take longer to support people. So I do want to level set around expectations as we continue to take significant cuts in DCHS, that we will continue to show up, we will continue to meet with everyone and do our best, and there will be longer times, and there will be a point when resources are not available, and that's just the reality.
I'm sorry, you were, no, I don't know if you were finished.
I am done.
So go ahead if you have a question. Okay. I was looking here at the culturally specific meals. Am I in the right division, or is okay, great. I'm just trying to find, page 49 in the budget book, the performance indicator on meals served. It's actually, looks like it's declining. So these are meals, the culturally specific meals served. We had a long conversation about this last year in the budget. And it wasn't a reduction in the meals, but they were spread among more organizations, I think is my recollection. So the target this year looks like it's down 16,000. Is this a case of the estimate from this year was higher than anticipated and it's not really a reduction, or it actually will be a reduction?
It will be a reduction. I'll have to double check to see if there's a reduction in funding. I know we had to do some moving of funding. I don't believe there's.
Yeah, I was trying to cross.
Do we know?
Check.
Why less? Yeah, I'll have to get back to you on the number of why the reduction is occurring.
Okay. And this can be a follow-up outside of the meeting. But I think last year, some of the maybe confusion about whether there was a cut and the sort of the impact on different communities was because of the increase in the number of providers. So it's dividing the same pot of money, or approximately the same pot of money, among a larger group. So my question would be, the reduction in meals, is that because some specific program has been cut, or is it like an across the board, or is there like another provider added? So I just be concerned about, I'm curious about how that plays out, because if it's specific to a particular contract or services provided to a particular culturally specific group, if it's 100% impact, or if it's like, this is, just across the board, everybody's going to, looks like there's somebody going to answer that. If I just keep talking, somebody will appear.
Good morning. My name is Marina Kalina, and I'm Senior Manager for Community Services Program. Good morning, Commissioners and Chair. Your question was about Community Services Nutrition Program funding. From the state, what right now we are hearing that the nutrition services programs will be funded leveled. So it means there would be no increase or decrease. So that is the kind of projections that we're working with. So we're not anticipating actual decrease in meals, right? But what we are hearing from the from our contracted partners, that the cost of meals, right, delivery, the cost of fuel is going up, and it might affect the number of meals that they're able to serve. So,
thank you.
Thanks, Marina. Okay, any other questions on ADVSD? Commissioner Singleton, I didn't know if you had any.
I do, thank you. I just want to come back to the questions Commissioner Moyer was running through about HR1 and the impacts. Are you all working with the health department? Are we working as one county on this same problem that we all have? Because I heard similarly health department saying they're working on solutions to the constant reauthorization that folks have to do.
Yeah, thanks, Commissioner. This is Rachel. We in one of our recent countywide federal impacts group, we discussed with the health department that we need to circle up around coordination related to HR1 impacts, and so we do have plans to do that. We have been coordinating pretty extensively with the Oregon Department of Human Services around this as well. So we really do want, to your point, a coordinated response to prepare and help our community be able to keep their resources. So I think it's a really important conversation, and we'll make sure that we are being intentional about that coordination and partnership with the health department. So we have plans to do that, and we will keep you posted.
Thank you. And I would, again, encourage either folks from HSD who are closer to the work on the ground or actual providers to be included, since we're all kind of serving the same group of folks, and as much as they can be aware of how to help people navigate it all correctly, then the better we can troubleshoot this. So it feels like an intentional work group might be helpful. On that same slide, you have a loss of 1.7 in Medicaid match due to general fund reduction. Is that a specific program offer or set of program offers? And how much was the general fund reduction?
What slide is this, Commissioner Singleton?
Slide 35.
I think slide 37 has the total. So if you go to slide 37, essentially we have general fund reductions of 1.2 million, and then we have a total of 1.7 million because of the Medicaid pieces of it. Now, some of those general fund reductions are the match pieces, and some of those are just straight up general fund reductions. All of that is because of the indirect reduction in the department. But really, you'll see that a lot of that general fund is leveraging Medicaid match, and it's sort of outsizing the cut in the general fund, if that makes sense. I'm not sure if that's exactly the question you were going for, Commissioner, but that's where those total numbers come from.
It is, thank you. And then I just wanted to confirm, I thought I heard you say, Irma, that it's about 3,000 households impacted or expected to lose SNAP across the state. Was that correct?
Yes, 3,000 Oregonians. And I tried to get the number for Multnomah County. and I was not able to, but
They
No
actually don't
worries.
have those numbers yet. We reached out to ODHS yesterday, and they don't yet have the numbers broken down by county. We'll get those
Okay, yeah.
to you as soon as they do.
Yeah, no worries. Thank you.
What is our caseload projection for next year? Do we expect it pretty similar, growth, reduction?
we will see some growth in our caseloads. And like I mentioned earlier, the state is looking at the workload model, so we're hoping that they include all the work that they're requiring us to do, as well as the caseload increase. And of course, the every 6-month check as well, so.
Okay, thank you so much for that, and we'll go to IDSD next.
Hello again. For the record, Alexis Ashby, Interim Deputy Director for DCHS. I just want to start by saying Tamara Barnes, who's the Interim Director for Intellectual and Developmental Disabilities, couldn't be here. However, I want to extend my sincerest gratitude for her stepping into the interim IDD role while I've been in this role. As you all heard at the beginning, we have lots of interims, but she's provided an amazing service to our division and department over the last 6 months, and we know she's watching, and just want to ensure she knows how much we appreciate and value her contributions. And so with that, I will jump in. As the largest county-level developmental disabilities program in Oregon, in Multnomah County, we serve about 20% of all enrollees across the state's IDD system. Serving individuals across their entire lives, we recognize that escalating economic and social pressures, including housing shortages and food insecurity, disproportionately affect the families that we support. In this challenging environment, maintaining these essential services in a stable, skilled workforce is fundamental to providing excellent care. Despite these stressors, our compassionate and committed staff continue to achieve meaningful outcomes for our community. Next slide, please. And next, I'd like to show a short video that illustrates the difficulties families face when navigating support systems for loved ones with developmental disabilities, as well as the positive impact of funding assistance and services. When I joined the county 15 years ago as a case manager, I came for the explicit reason of helping to improve outcomes for other families because I was a family member of someone who experienced their own intellectual and developmental disability. And what this video will show is that many individuals and parents in these situations can experience profound isolation and are often unaware of the specific services available to them. Improving access to information about county programs is vital. It's a part of our mission to ensure that every person who is eligible for our program receives timely information and access. Go ahead, Tasia.
The challenge was he was not speaking, not even a single word. And we started seeing the signs of him, flapping his arms, spinning and turning, and it was like, we might need to have an intervention to really understand what is going on. My personal view is that each one of us, on different categories and lifestyles, each one is facing different set of challenges. No single parent should feel isolated because of this challenge on autism or behavior issue or any other issue for that matter.
When I first met this family, they did not know about the services that were available to them. So I think the first step that we went through was just educating about what you could have. The biggest problem is people getting through our own bureaucracy to access the services. And then also accessing Medicaid, you have to reapply every year. These folks are in a different spot, but when you have to reapply every year, there's the possibility of that's a lot to get through when you already have a disabled child, or if you or yourself are disabled. I've seen this evolution of not only building and providing more supports to people so that they have this life and overcome their disabilities, but also educating them and letting them know you have rights. You have the ability to make choices, which was also something that was not offered.
Every brain is beautiful. Every difference should be celebrated. I think it's really important that we are kind and patient with each other, because every different way somebody thinks is a value add. These programs are not just for our disabled community members, they're potentially for us.
Information. Information is power. Without information, you cannot do nothing. We get the information we need from Erica, for the program through the county, and the avenues of assistance available. He started learning alphabets in Russia, alphabets in Kazakhstan language. We feel, there's somebody cares about the challenges we are facing as, and we feel that we belong to a team. We're not isolated.
Thank you, Tasia. Next slide. So in our program, we support the quality of life and community inclusion for people with intellectual and developmental disabilities by providing case management and supported access to funded services. We strive to eliminate barriers to service delivery based on race, background, or circumstance for every person we serve. We provide impactful, culturally responsive services to the most marginalized in our community, supporting people across their lifespan, children, adults, and disabilities, and older adults. Right now in Multnomah County, we serve 8,149 clients. This includes 6,420 individuals enrolled in case management services, and we also provide additional oversight throughout eligibility and abuse investigations for all clients in Multnomah County who identify as someone who experiences an intellectual or developmental disability. And then in terms of our comprehensive support services, we provide person-centered, community-inclusive support that directly links clients to Medicaid funded and community resources, some of which are rent assistance. In addition to case management, we provide in-home, residential, and supported living services, housing assistance, transportation services, employment community inclusion services, employment pathways, and ongoing employment support like coaching services. We also help individuals with self-employment support, assistance with establishing a business, and this includes business coaching and planning, resource for funding a small business grants for entrepreneurs with disabilities, workshops on marketing, finance, and growing a brand. Also like to plug the annual art show that's going to be hosted by Intellectual and Developmental Disabilities in partnership with Caldera Art Studio on June 6th. Everyone's invited. Next slide. And so our service population is very diverse, as you can see on this slide. We represent the racial and ethnic composition of those served across Multnomah County and across diverse backgrounds, and individuals who speak 41 different languages. We continue to evaluate client demographics as we assign knowledge, skills, and ability positions, as we know that individuals have better outcomes and better interactions with service delivery when they receive culturally responsive and linguistically specific services. We also evaluate our clients' served data disaggregated by race, ethnicity, and language as compared to census data to identify the need for targeted outreach if we identify underserved populations. Next slide. So for the IDD program operating budget for fiscal year 27, we are submitting a $47.1 million budget. This is a projected increase from the 2026 budget of $38.9 million. A large portion of this is due to state and federal fund increases. Earlier, Commissioner Murray, you asked about the biennial funding, so this is a part of that 25-27 budget reallocation. So we will see an increase in positions. However, we will see a decrease in our supportive housing services. Our funding is going to decrease from $700,000 in 2026 to $500,000 in 2027. I would like to note that the permanent supportive housing position has been reallocated using county general funds. This is super critical for our program because this is the only entry source for someone who is houseless and experiences an intellectual or developmental disability to gain access to permanent supportive housing directly from houseless homelessness. And as Rachel mentioned, I always like to say it's not about getting keys, but keeping keys. Our program has a 99% housing retention rate when someone gets enrolled in our services. And so through our, though our county general fund constitutes a smaller portion of our overall budget, this investment is strategically vital. CGF supported positions are foundational for meeting mandated service requirements, ensuring technical integrity, and maintaining regulatory compliance. In short, the CGF investments in these targeted positions are a crucial lever for the division to meet legal mandates, provide essential public health and safety net services, and operate with necessary accountability and effectiveness. Next slide. So how our budget delivers, as I mentioned earlier on in the presentation, we are one of the largest CDDPs across the state, and we continue to see significant increase from about even 10 years ago with the evolution and onboarding of Title 19, K-Plan services. Folks are able to live in their own homes or community-based settings of their choice, which is a positive, but it does mean that our program continues to grow. Our intake team processes over 1,500 eligibility referrals annually, and 100% of those intake appointments are conducted in the applicant's primary language and at a location of their choice. For our case management between adults and children, we provide direct case management in the community, serving 6,400 clients. Our plan of care team is helping to support thousands of personal support workers through processing of timesheets and onboarding to the system. Annually, we process 20,000 timesheets. And then our abuse investigation team screens approximately 2,000 reports of abuse annually. Innovation and operational efficiency are crucial for the division's sustainability and ability to meet the increased demand. As you all know, we have a workload model that projects forecasted growth. We continue to outpace that. And so we're really thinking about how we can continue to keep mandates up to date, as well as increasing the efficacy for the individuals that we serve. So we're really thinking about how our client-facing services, and we can innovate around technology to support individuals, as well as developing metrics and outcomes that really highlight the effectiveness of the programs that we are operationalizing. Next slide. And for our outcome statement for this year, we really focused on individuals with intellectual and developmental disabilities have equitable access to IDD services that support quality of life. And this outcome is really focused on increasing IDD services for people with intellectual and developmental disabilities to get intakes conducted in the language of their choosing. We understand how language access is critical to understanding not only services, but what someone's individual's rights are and how to navigate the application process and intake process, which can be really complex. So for us, it's really critical that we're ensuring that individuals have appropriate access to the process. And approximately 10% of all intakes are conducted in a language other than English. And we, for fiscal year 26, we're expected to complete 975 new intakes. Next slide. So this is where we provide services. Multnomah County IDD delivers comprehensive, culturally responsive, and community-based waiver services, actively meeting clients wherever they are, including their home or community-based location of their choice. As you can see on the map, the areas that are concentrated in dark teal or darkest blue is where we have the highest concentration. We know that more folks are moving to middle and eastern county due to cost of living, but we really are serving folks all over Portland, all the way to Corbett, and we show up in any setting that someone chooses, whether it's a hospital setting, a school setting, their home, a coffee shop, whatever's convenient for the individual. So we are out in the community yearly, every day, sometimes multiple times a day. Our case managers are meeting individuals, and so this really gives you a glimpse of where folks are showing up. Next slide. And so challenges and responses. As I spoke to, the reality is that our budget for Medicaid services is operating on a workload model that is currently under review. However, even with the full workload model, we're only funded at 86% of what it costs to do business. And that does mean that we'll continue to see rising caseload numbers and workload offsets that we have to address. One of the benefits for us in Multnomah County is the CGF that I talked about. That is the only way that we can close that gap and ensure that we can provide timely services and we can keep caseloads manageable, because we don't want to see a revolving door of staff through burnout and other challenges and vicarious trauma that they are experiencing. And so we're continuing to both advocate with our state partners around funding decisions and technical support, as well as thinking about internally what type of innovations we can do to reduce administrative burden for case managers. And then challenge two, we are aware that the state is moving to a statewide case management system. That's a massive lift to do any new system statewide, especially when you have some systems across the state that are already independently operating. And I will say that in Multnomah County, we do have a pretty robust case management system. And so we are advocating for additional support with the onboarding and additional timing to onboard to a new system to support our case managers. And we were just notified last week that they are going to do that for us. So very excited about that. That will really help us to be successful in ensuring that, one, we have clear data and data integration, and that we can continue to provide effective case management to individuals as we're going through this change. And then another problem that we're experiencing specifically in Multnomah County, and I know that it is happening statewide, but more specifically in the metro area, is the evolving acuity of the complexity of the individuals that we're seeing, individuals who are seeing more co-occurring diagnoses between mental health and behavioral health and their IDD or DD diagnosis. And so our work right now is really to integrate our systems of care, working between our program as well as housing services and behavioral health partners to create a unified interdivisional response to address the whole person. Excuse me, too much hand movement. And so that no client is left navigating all of these high acuity crises without a coordinated support system. And then finally, the decrease of assistance in housing funds. We know that there are not many funding sources for folks who experience an intellectual or developmental disability, and the cost of increase of living in our county is significantly impacting our community specifically, who is more at risk of underhousing or houselessness. And so we are currently working to integrate our service coordination across the broader county housing initiative. So really thinking about how do we intersect with our partners in YFS or HSD and other programs to make sure that we have a warm handoff, and or if there are folks that can't be served in other systems that may be eligible for our program, that we're receiving those referrals directly. And so some key takeaways is while the division cannot control federal allocations, we can control operational efficiency and workforce preservation, investing in the mental health of our staff and the streamlining of paperwork and most effective way to maintain a commitment to the community during a fiscally lean period. Next slide. So as a result of the department's indirect rate drop, the IDD division needed to take a 13% reduction of CGF to meet the total $137,000 reduction. However, there will be no reductions to staff FTE. The benefit of having that biennial funding is that we were able to swap out those positions that would have been reduced with state mental health grant funding, so we're able to absorb the reduction and have no impact to FTE. And we've also been able, and we've reduced our reliance on the match project over the last several years, because it really is contingent on the fluctuation and the ability of CGF to be leveraged in the division, which is unique and it's different, because in aging, they can apply for the match up front. In IDD, it has to be reserved as a last resort and a safety net, and so you have to have confirmed CGF to actually apply. So every time we have to reduce CGF, we reduce our ability to actually match those additional funds. Next slide. And then finally, this is our last reduction, and this was our general fund reduction. It's $98,000 that would have gone to the match project that we will return as a reduction for our CGF. And with that, I will pass it over to Lori.
Wait, before you ask questions, the art fair is on June 4th. So right after you adopt the budget, you just head over there. Yeah, it's going to be awesome.
Okay. Great. Okay, we'll open it up for questions. Thank you, Alexa.
So I've got a couple of questions. Thank you all. I know this is a lot to go through, so I appreciate all of the presentations thus far. Alexis, you made a comment that there's only one FTE for folks to access PSH who also have intellectual and developmental disabilities. And I'd like to clarify that a bit because it sounds like that sounds different than what I think it really is, which is you have one staff dedicated to that, but folks are being served throughout the community who can access PSH. So this is really about DCHS staff, correct?
I mean, technically, that is true, that there could be other programs that should serve folks who are houseless and experience an intellectual and developmental disability. The reality is that individuals who experience intellectual and developmental disabilities need more support navigating the continuum of services to gain housing, permanent supportive housing, than someone who doesn't. And with the funding that we get with SHS, we only have one position to do that work. Also, for folks who are not currently enrolled in case management services, there's no other funding source in Medicaid to serve that community. So it really is the one door for that population.
So I just have to push back. That's just from my experience on the ground. That's just not entirely accurate. They do need more support and additions, but it doesn't mean that folks aren't being served in other parts of the system. And I think it's important because one FTE for a large population is woefully inadequate. It doesn't mean that everyone's getting exactly what they need, but I don't want to give the false impression that folks are not getting assessed for coordinated access. I also want to ask, why we only have one staff who can serve those folks? Is the rest of the trained on how to do the assessment tool?
Commissioner, you cut off at the last part of the question there, if you wouldn't mind repeating it.
Oh, I was asking why it's just one FTE. Are the other staff in this division not trained to conduct the coordinated access assessment to get other folks on the PSH waitlist?
Good question, Commissioner. So the other staff that are in intellectual and developmental disabilities are funded through the workload model for case management services, and that's not a reimbursable funding source. So earlier when I was talking about funding for actually serving houseless individuals who are not connected to the program, that's because we need an entry point for those folks, and the Medicaid model for IDD services does not cover outreach and referrals. So these are for folks who are not currently enrolled.
Okay, but other folks who are enrolled, if they are also houseless, your staff can conduct the coordinated access assessment for them?
Yes, that is correct.
Okay, thank you. That's all my questions.
Thank you. Any other questions?
Yeah.
All right, let's do it.
I'm curious about what we track when it comes to case management and the goals laid out in people's individual service plans. Like, could you pull a report for me that said X percentage identified a desire to be employed? And what percentage of those who identified that as a goal are employed?
That's a great question, Commissioner. So there's two different data sets that we would likely pull. So we have our annual customer satisfaction survey that talks about folks' access and their desire to gain different services, whether it's employment, housing, where they live. And so we could pull that data and say, like, if you access this service, did you get this service? In our system, we can pull how many folks are enrolled in an employment service based on total population, and we could do a comparison. But we don't have a data set that marries the two. So it's, again, goes back to that earlier conversation of how do we create a more integrated data model that can collect all of these different pieces of information because they're coming from different places.
So if I'm a case manager, what is my caseload right now? Ballpark?
On average, around 60.
Okay, so I have 60 individuals. Each one annually I have to meet with in person and work with them and any of their natural supports to come up with an individual service plan. In that process, we're going to talk about goals, things that they want, which change over time and different stages of our lives. We are concentrated on different things. How, as a case manager, without going in maybe you do have to go into each individual case. How are you tracking progress on the goals in which we support? I mean, people have individual goals that are not related, like, I want a boyfriend, I want a girlfriend, that stuff, right? We're not actively, well, we might help with community inclusion, but we maybe can't mark that as a goal. But of the things that we have a role in, how are we able to, on a person basis, how do we track the efforts we're making? You know, some things are harder than others. I'm very aware there are a lot of people who would like to live independently, and Medicaid does not pay rent, and therefore they end up in a setting. I argue that the federal government needs to look at the Supreme Court Olmstead and decide if they're actually following that. But that's not on us. We do have people who wish that they lived independently or with their own roommate. So I get that some goals might be harder to achieve, but how do we track the effort we put in to those goals? Because, you know, I get a lot of feedback, and I don't even know how I would ask.
Yeah, that's a great question. So we do have an operations team that tracks both effort. So how often are we meeting the actual mandates, meeting folks in their community, reviewing their ISPs, reviewing their ISP goals, reviewing their finances, their housing, their medication. So we have goals that track all of those things, and we actually use our operations team to pull that data monthly so that supervisors have that information and they can review with their individual case managers, because it would really be monumental for each individual case manager to do all of that data pulling and tracking themselves. And so that's one of the ways that we're trying to innovate around tracking and data metrics, by removing that administrative burden from the case manager. Now, getting down to the granular level of, Joe said, I would like a job, and next year when we do that review, did Joe get a job? That is happening in those conversations with the individual and their ISP team. And then when our operations team is we do internal audits, we review those goals and those metrics, and we do spot checks. And then if we see that maybe a goal was identified that was not being addressed, then that would be the supervisor following with the individual and their team to understand what were the caveats or maybe barriers, and then creating a pathway forward.
And I'm curious around the experience of our case managers and how stretched they feel. I know that, you know, like everyone who carries a caseload of real people, you're going to have some individuals whose needs are very, very high, and you're very frequently needing to spend time on that case. And then, you know, there are others that luckily things are going pretty smoothly for, but it also makes it very difficult to help those people on their goals if there's not literally a crisis. I am really concerned both with HR 1 and the state not updating caseload of, you know, how real is time restraint on our ability to really engage in somebody's, you know, real person-centered planning.
Thank you, Commissioner. Can I say ditto? I mean, that's a conversation that we're, you know, obviously having all the time with our case managers, understanding that these are real people's lives, and lives are complex, and they don't live in boxes. So the one things that we can do that we do have control over is we do specialized caseloads, and then we make reductions for high acuity caseloads. So we have CM3s who provide support to individuals who are categorized as high risk, and so then we reduce the caseloads to understand that there's going to be more time and more complexity to that individual case. And then there's all the way to folks who are in case management only services, who are not in a long-term service or getting an annual ISP ISP, we would have them with a CM1 who still can do choice advising, get connected to housing services, more of the administrative pieces so that it reduces the burden on that middle group of case managers, the CM2s, who are doing the ISP plannings, the employment planning, the transition planning, all of that. And so that's one way that we really try to be intentional about supporting the spectrum of need, and recognizing that even with those, we still need support with additional funding to reduce caseloads even further.
Yeah, I mean, one of the things that I think is a wonderful development, but it does add workload, is that we now have 2 or 3 generations of individuals who grew up having access to K-12 education and being around peers their own age, and it has fundamentally changed expectations people have for themselves. And you know, I think sometimes parents have come along, sometimes parents have not come along. But we have a lot of individuals who experience intellectual and developmental disabilities who know that they can live in the community and know that they can have jobs, and may need some support doing that. But it is not like the day, I mean, literally in Oregon, there were days where people said, send your child to Fairview and don't think of them again. That is Oregon's future. I mean, past, not future. Good Lord, no. They're past. So it is a workload issue. And that is one of the reasons that I worry that, you know, do staff have enough time to help people meet their goal? And that's real. You know, I really think there are a lot of people who live in circumstance. I mean, I don't think I know, because I worked for an organization who literally visited thousands of individuals. There are a lot of people who are in a more restrictive setting than they wish to be. And that's hard. I mean, I think where you live is such a fundamental right. When somebody says, I don't like where I'm living, but our case manager knows that they're safe and they're fed and there isn't, concerns about the quality of care, it's just not what they want, it makes it very hard for that to rise, because that is not always the case. There are crisis situations every day. So I don't want to lose this conversation. I think it's one that I'm going to want to watch, especially with things like HR1, about how much time can our case managers actually spend helping people on their life goals versus being a crisis management job, because I think that is a very different system. One is like keep people safe, and one is helping people thrive. And I don't want us to not have a way of seeing if that's eroding, because I worry about that with what the state might also choose to do with their budget reductions in the coming years. So I just flag that as like something I'm really interested in watching and engaging on.
I want to do a quick time check because we have Youth and Family Services Division left and Preschool and Early Learning Division, and we have about an hour left. We do have a little time on Thursday afternoon for follow-ups if we need that, but just wanted to do a time check on that. Any other questions for IDDSD? Sure.
These are more overarching. First of all, great that 100% of the referrals happened in somebody's home language, the intake appointments. And related to that, I was looking at the key performance indicators for the division, and the first one related to equitable access. I'm curious about the overall service delivery. So like what the denominator is of the individuals that you think or we know would qualify for services. Because so equitable access is sort of like, do they have the same 10% equitable access as everyone else, or is it 80% equitable access? So it was somewhat confusing to have a benchmark that is, actually would be linked to a larger benchmark, but not to see the larger benchmark, unless I'm missing it somewhere here.
So I think I heard two things. So the larger benchmark would be the total individuals that are enrolled across the state. That's around 30,000 individuals. When we're looking at demographic data of representation in the county, because we don't have access to prevalency data, which I think is the other question, like what percent of individuals in Multnomah County do we believe have a qualifying diagnosis versus how many we're serving? We don't have access to that data. The state doesn't collect that data. It would be great if they did. So what we do is we compare census data of what population of individuals may be experiencing a disability, and then we track against that. And so if you look at our slide 42 that talks about race and ethnicity demographic data, that's the standard that we use around representation desegregated by race. Does that make sense?
So the county doesn't have any idea what or even an approximation of whether individuals who would qualify are actually accessing services? I'm just curious because I'm thinking with the, I'm just going to take a K-12 example. So when students enter the public school system, there's an assessment. I mean, there is actually a fair amount of data because they're accessing service through either, 504 plans or, individual development plans. And so I'm curious, we don't have some sort of modeling to sort of try and track what that universe is?
We have forecast data, statewide forecast data that talks about how many folks they believe will enroll and should enroll, but we outpace that data in terms of enrollment numbers. So if we are talking about how do we know that we're keeping pace with requests? We know that. If we are asking the question of how many folks should have a qualifying diagnosis and are we serving all of those individuals, that's the data that the state does not have and doesn't collect. And there's plenty of people who do collect data on it, but it varies widely depending on who you're getting the data from. And that's why it's hard to nail down and say in Multnomah County, 8% of residents should have a qualifying diagnosis or, some number of that sort. So that's why we use census data.
I'm sorry, I just want to make sure I heard you correctly. You said that the state has forecast data and that we outperform the forecast data? Is that what you said? Okay.
We're outpacing. So they might say that we're expecting a 8% growth. We would say, well, we're always going to be at least 2% higher than that because more folks are enrolling locally in Multnomah County than any other part of the state.
Okay, that would just be an interesting thing to know. And then I was curious about this slide here, 46, this is the geographic information. And just the concentration in sort of East Portland / East County. And I'm wondering if that's because, is that where in general people are living independently, or is that because there's facilities or homes that serve that population and that's where they're based? Because I know, for example, there's a lot of home care provided in East Portland.
Yeah, there's particularly a concentration of homes in that area, but there's no concentration of living situations, meaning we have folks who are living in all types of living situations, not just care homes, and majority of the individuals in our program actually live independently or in their family home, so not in a residential setting.
Okay, so it's the former.
Yeah.
Okay. And I think that is all for now.
Okay, I think that's all for IDDSD. We'll go on to YFS.
Good morning, Chair. Good morning, Commissioners. My name is Lori Stegman. I use she, her pronouns, and I am the Youth and Family Services Division Director. To kick off YFS's budget presentation today, I'd like to share this short video that highlights the generational impact that our services have on our community and residents. Tasha, you want to play our video?
California when I was 4, so I went to Davis Elementary first, and then Hartley, and then Alder, and that's where I first kicked off my first sun year, 4th grade. Definitely for me, but also I wouldn't say for my mom. So we attended like adult classes where they were able to do like English to Spanish, and so I attended as a student or as a participant, and she as the adult, and so I think that also definitely gave us that exposure of like getting that academic opportunity to improve on our English. We've seen it in our data itself, the growth of attendance when a student is attending every day, but then also academically, because we are an academic/enrichment program, we connect with our teachers and staff to kind of mirror what is going on during the school day so we can have that in after-school program. I would say definitely just seeing this. I came here from California when I was 4, so I went to Davis Elementary first, and then Hartley, and then Alder, and that's where I first kicked off my first sun year, 4th grade. Definitely for me, but also I wouldn't say for my mom. So we attended like adult classes where they were able to do like English to Spanish, and so I attended as a student or as a participant, and she as the adult, and so I think that also definitely gave us that exposure of like getting that academic opportunity to improve on our English. We've seen it in our data itself, the growth of attendance when a student is attending every day, but then also academically, because we are an academic/enrichment program, we connect with our teachers and staff to kind of mirror what is going on during the school day so we can have that in after-school program. I would say definitely just seeing the smiles every time I go in and seeing them. They'll still remember like Miss Rosita and kind of just coming up. Definitely a reward is seeing them grow up. Currently there's a couple of students that I had when I first started when they were 2nd graders, and so just seeing them now here at the high school and still getting to know them, and now they're juniors, has been definitely very rewarding. As a student and now as a person that's been within the Sun Service for 10 years, I have nothing but great things. Just the tremendous growth that I've seen within the schools that we serve, and just expanding that, and then within my personal experience as well, just being where I am now, I don't think would have happened without Sun. So.
So as you can see, this video is a really great reminder of why we do this important work here at the county. Next slide, Tasia, please. In YFS, we serve over 39,000 people of all ages to break down barriers that prevent them from fully realizing their potential. This includes individuals and families, survivors, immigrants, and refugees, communities of color, and other underserved populations. This highly diverse population are people most impacted by disparities. In fiscal year 25, 69% of children and youth served in our Sun Community Schools who were enrolled in activities identified as BIPOC. 84% of domestic violence survivors served were members of culturally specific communities, and 83% of those who received emergency rent to prevent imminent eviction identified as BIPOC. Next slide, please. Our fiscal year 27 operating budget is $87.8 million, which is a $14.5 million reduction from the fiscal year 26 adopted budget. I'll offer more detail on the reductions in the next slide, but first want to provide additional information about our FTE. For fiscal year 27, there are 89.3 FTEs, representing a reduction of 12.7. 1.5 were cut in the fiscal year 26 rebalance as part of OREDAP, which stands for Oregon Eviction Diversion and Eviction Program. This is funding that we receive from the state for imminent evictions. 1.2 is a reduction of 2 county general funded positions. The remaining 10 positions represent the data and evaluation team staff that will move from the YFS division to the director's office and are not a reduction in personnel. Next slide, please. This slide highlights significant reductions from fiscal year 26 to fiscal year 27. $3.9 million in SHS funding was moved back to the HSD budget. This is funding for permanent housing vouchers that are allocated to Multnomah Stability Initiative participants. This is a technical fix, and there is no reduction to this funding. A $672,000 reduction in SHS funding, including $462,000 for Gateway Housing Advocacy Services and $210,000 in one-time only eviction prevention legal services. A reduction of $3.5 million overall in energy and weatherization. For energy assistance, the reduction is due to a reallocation process. For weatherization, the Department of Energy canceled an innovation grant, and for fiscal year 27, we were more conservative in our estimates due to federal award uncertainty. A state reduction of $5.2 million in OREDAP funding for the biennium that was reduced during rebalance. County general fund reductions include a $1.25 million reduction to Sun Community Schools and a $1.1 million reduction eliminating the Regional Multnomah Stability Initiative services, and $2 million for the data and evaluation team that was moved from the YFS division to the director's office. I also want to highlight one-time only CGF funded programs that are not continuing in fiscal year 27. Those include $2 million for family resource navigators, $128,000 for fair housing testing in East County, and $74,000 in East County culturally specific community food systems. There are also 2 notable additions to the budget that I'll talk more about later, but I wanted to provide some context. One is the $4.5 million increase in the Medicaid Waiver Rental Assistance Program, known as MRAP. MRAP administers the Medicaid 1115 HRSN waiver. Within the waiver, there are many provisions, one of which is the Health-Related Social Needs HRSN benefit that covers housing services. This increase from $10 million to $14.5 is due to increased capacity to bill Medicaid grants and prevent evictions, bringing in additional dollars to our community. There's also an additional $200,000 of one-time only county general funding for rapid rehousing supports for MRAP. Next slide, please. The Youth and Family Services Division addresses barriers to improve stability for families by meeting them where they are through strengths-based, trauma-informed, and culturally responsive and specific services. We manage over 30 programs within 5 core service systems and policy areas that include energy services, housing and economic stability, education supports, early childhood, and domestic and sexual violence. The majority of our services are delivered through contracted CBOs, with the exception of a few key teams, including the Weatherization Team, the MRAP Team, Bienestar de la Familia, and the Domestic Violence Crisis Response Unit. And I have to stop for a moment here and brag about 2 of our teams, the DV Crew and MRAP teams, who both just received Employee Recognition Awards. Because of YFS's flexible and responsive approach, we have built strong relationships with key community partners at the local, state, and federal levels. This has allowed us to pivot and activate turnkey processes and the effective deployment of staffing in times of crisis. For example, with a myriad of federal actions and impacts, including SNAP, the SNAP freeze, and ICE activity, we have been extremely nimble and successful in getting resources to those most in need. Next slide, please. The term eviction prevention gets used frequently and in different ways by different folks. To help understand how YFS thinks about eviction prevention more broadly, we created this visual. Upstream, you see primary prevention activities beginning with family stabilization services, where we take a 2-generation or whole family approach to address poverty and well-being. By creating stability, we are able to reduce the threat of evictions. A little farther downstream, our housing stability programs provide short-term case management, advocacy, and client assistance support to keep families stably housed. And farthest downstream are our imminent eviction prevention programs, where we support households at immediate risk of eviction. These are folks that have an eviction notice, a court case, or are at risk of eviction within 21 days. At this stage, our goal is to divert them from losing their housing. Next slide, please. Here are a few highlights of how our budget will continue to deliver life-changing services to our community for our most underserved individuals and families. Eviction prevention programs and emergency rent assistance will help thousands of families stay housed and prevent them from becoming homeless. And with a growing increase in homelessness, there continues to be great need. The proposed budget investment of $3.5 million of ongoing county funding in emergency rent assistance and crisis case management will leverage the state ORIDAP funding. And the Medicaid 1115 HRSN waiver will bring in an estimated $14.5 million. Together, this will allow us to prevent imminent eviction for an estimated 2,370 households. For energy assistance, we will help support 21,000 households to pay their energy bills and prevent utility shutoffs. Our community continues to struggle under the weight of drastic increases in energy utility bills. In fact, residentials of both PGE and Pacific Power have seen increases of close to 50% in their energy rates since 2020. Increasing food security is a top priority for YFS. In fiscal year 27, the Sun Child and Family Hunger Relief Program will continue to provide 1.5 million meals to children and their families through food pantries and summer meals at our Sun Community Schools. Sun Community Schools provide and integrate supports to meet basic needs, provide after-school and summer programs, and engage families to reduce learning barriers. The 83 Sun Community School sites funded in the budget will serve 16,200 children and youth in enrolled activities and thousands more in family and community events. As part of the much broader set of our domestic violence and sexual assault services, we will respond to over 11,000 survivors at the Gateway Center and support 2,500 survivors to access protection orders to help keep them and their children safe. Next slide, please. But it's not just the number of individuals and families we serve that's important. It's about how we deliver equitable access and leverage limited resources. YFS is intentional about meeting people where they are and providing services in person and/or virtually based on clients' needs and preferences. This slide shows how the Gateway Center is responsive to survivor needs, pivoting and innovating as needed. From serving as a hub for co-located services to implementing a fully remote restraining order process with the court to increase on-site staffing for drop-in clients. It's also important to note that YFS leverages its finite resources by bringing over $46 million into the county. Next slide, please. YFS has 4 division outcomes that reflect the county's strategic plan and metrics. They are 1, safety and resilience, 2, economic stability, 3, educational opportunity and success, and 4, health and wellness. I'll be sharing a few highlights of the key performance indicators we track from 3 of our strategic outcome areas. Our first outcome is safety and resilience. In our Domestic and Sexual Violence Coordination Office, we deliver crisis and legal services for domestic and sexual violence survivors from all communities with a focus on underserved populations. Programs include advocacy support that engages with each survivor to develop an individualized safety plan. This KPI shows the percentage of survivors who engaged in safety planning over the last 3 years. Our target is 90%, and we consistently exceed that target. Next slide, please. Our second KPI is economic stability, which is the number of households that achieve stable housing and increased economic stability, thus avoiding eviction and homelessness. This slide shows the distribution of emergency rent assistance across the county. The heat map shows the number of households per zip code that received emergency rent assistance and avoided imminent eviction in fiscal year 25. The darker areas represent higher numbers of households. As noted in the footnote at the bottom, for fiscal year 26, the numbers in the chart reflect emergency rent assistance, MRAPs, Medicaid 1115, and Family Resource Navigators. Next slide, please. Our third KPI is educational opportunity and success. This KPI shows the percentage of children served that consistently attend school. As you can see, there are strong, consistent school attendance outcomes for children who participate in SUN activities on a regular basis. In each of the last 3 years, SUN has exceeded its target, with 74% of those children consistently attending school in fiscal year 25. Next slide, please. This slide shows a summary of the challenges YFS is facing and how we are responding. For imminent eviction prevention services, we are advocating for additional state resources and ask for $3.5 million in ongoing versus one-time only emergency rent assistance. Thank you, Chair. As you know, there is a significant federal budget uncertainty. The President's budget calls for an overall 10% cut to non-defense programs. As a reminder, the President's budget from last year included many of the same proposals as this year, but Congress did not implement most of them. We continue to advocate and offer subject matter expertise to our congressional delegation. Due to H.R. 1 policy changes, our community members are feeling significant impacts of reductions in accessing SNAP. Thousands have lost SNAP benefits, and there's an increased demand for food resources in our SUN Community School, food pantries, and Bienestar de la Familia hunger relief programs. These changes began in the fall and will roll out over the next year. Unfortunately, the MRAP team encountered households who were evicted while waiting for the Medicaid 1115 HRSN emergency rent benefit. These households have the potential to be disqualified from receiving benefits since they are no longer housed. Filling this gap is the motivation for the add package of $200,000 one-time only funding in the submitted budget. This will allow immediate resources necessary to rapidly rehome households who were evicted while waiting for this benefit. As you heard from Alexis earlier, we are facing the impacts of federal immigration policies. Fortunately, we have talented and committed staff who are subject matter experts who support the county's federal impact group. Next slide, please. This slide shows the 1.2 FTE reductions to meet the indirect shortfall in addition to the 5% general fund constraint. Next slide. This slide shows the 2 general fund program reductions in the chair's budget. For context, as mentioned earlier, it's important to recognize that YFS is funded with a high proportion of county general funds. Because of this, our budget contains significant reductions to meet the constraint. I also want to recognize that these cuts have a large impact in terms of numbers to be served and CBO FTE. The first general fund constraint is the Multnomah Stability Initiative reduction of $1.1 million for regional services. MSI offers individualized case management and financial help for families to maintain stable housing. They also provide access to job training and apprenticeships, as well as legal and educational support. We estimate this reduction will eliminate 10 full-time case management positions across our community partners, cutting the number of households we can serve by 43%. This limits housing stability case management to 228 of the 400 households typically served. The second general fund constraint is a $1.25 million reduction that eliminates 9 Sun Community School sites. This cut reduces the total number of sites from 92 to 83 and eliminates multiple positions across our community partner organizations. Each Sun Community School location has a full-time site manager and a part-time extended day coordinator, along with many instructors. This reduction results in the loss of services for up to 1,800 youth and 450 adults who rely on these schools for educational connections and resources. As you saw in the video, Sun Community Schools are much more than just the extended day activities. This cut will also mean the loss of school-wide support and family engagement that drives school attendance. Next slide, please. This slide shows new YFS funding for the fiscal year 27 budget. It includes $3.5 million of county resources, once again, for eviction prevention, meaning emergency rent and crisis case management for households at risk of imminent eviction. This is a critical investment to keep renters from losing their housing and to reduce the inflow of homelessness. We estimate that this investment will prevent eviction for 500 households. This shift from one-time only to ongoing funding will offer stability to the program and staffing, which is essential to provide continuous, efficient, and quality support to households facing eviction. Ongoing funding will also allow providers to have known funding levels for the next year early on and be able to prepare for the next fiscal year so that there aren't gaps in services at the beginning of the new fiscal year. The Medicaid 1115 HRSN program will bring in an estimated $14.5 million in federal reimbursement in fiscal year 27. And the last item is a one-time only county general fund investment to address the challenge I mentioned earlier that has arisen in the Medicaid 1115 HRSN program to prevent potential recipients from being evicted while waiting for benefits. So as you can see, DCHS, and especially YFS, truly are the heart of the county, serving so many individuals and families at all stages of life. This concludes my presentation today. Thank you so much for the opportunity to share the incredible work of YFS and its amazing staff and partners. I'm happy to answer any questions.
Thank you so much, Lori. We'll open it up for questions from the board for YFS.
So I just wanted to start with an appreciation of the team. For commissioners, it's one of the amendments I issued put out early in our process to look at the eviction prevention, and particularly the eviction prevention in-reach team that is focused on some home forward properties, but also will help leverage the Medicaid benefits. So I want to thank you all for digging into that with me. I think it's a really good opportunity to leverage funds, but also to help support our largest landlord of affordable housing and make sure that we can find ways to get households there stabilized. So I know there's more to come, but just wanted to appreciate y'all digging into that with me. I have a couple of questions. On slide 61, I would just be interested in follow-up if you could send this data disaggregated by race. And part of where I'm going on this is the equity index tool and some of the decision-making around SUN that was shared with us categorized everybody in BIPOC category as opposed to disaggregated by race. And the data on educational achievement is disaggregated by race. And I see that we continue to have across the state, not just Multnomah County, but lower outcomes for Black and Native or Indigenous students. And I'm wanting to understand a little bit better how this data is showing up for those races disaggregated, not into a whole BIPOC category. Is that something that's possible that you'd be able to follow up with?
Yes, we can get that for you, Commissioner.
Thank you. My other question about SUN is I recently had an opportunity to meet with some providers because, with all honesty, it is very difficult to track which program offers fund SUN because my understanding is it's in a bunch of different places, but also some agencies leverage case management dollars from other program offers that then support SUN. I do think it would be good for us to get a little bit clearer on the overall funding for SUN schools at some point. But in particular, a question that came up for me is have we considered using catchment areas instead of specific schools? I'm concerned about the Cairo SUN School being defunded when it serves such a large portion of Black folks. And again, coming back to the low educational achievement for those students across the state, wanting to understand how could those students be served, or could they be served if we thought about more of a catchment area as opposed to just specific school investments?
Thank you, Commissioner. I know that we use the equity index, so I'll have to check back with Walter as far as the catchment areas, but I know that the equity index was one of the main tools that we work with to identify the schools.
Yeah, I appreciate that, but my challenge there is, again, it's all listed as BIPOC, and there's a significant number of schools or services being closed that are culturally specific for Black students, who again seem to have continue to have the lowest achievement numbers across the state. And so I'm not sure that the equity index tool maybe told us what we needed to know at a more disaggregated level.
Thanks, Commissioner. I just had a follow-up question just to clarify. When you're talking about this catchment area, are you asking, is it possible to allow for like students to attend perhaps like another SUN site? And if
Absolutely.
Yes, so that's something that we are, there was a lot of conversation around catchment area related to like the decision-making regarding the actual reductions of schools, but then we have explored and we actually have met with all of our SUN providers and plan on having additional conversations around like how do we support families who may lose this resource and explore some of those opportunities. And it is challenging, I'll say, for one challenge that we'll need to overcome and look for a solution around is that like PPS doesn't do bus service anymore, and so we'll have to, those are the conversation we're having, is there other opportunities for us to explore related to that, and so we'll keep you posted, but that's certainly very much of interest to us and to the providers as well, and when we know to families for sure.
Thank you. I'll definitely stay close with you on that. I'm very interested if there's opportunity there. I also wanted to appreciate the Gateway Center. I know I've been talking a lot about making sure it's accessible, and I really appreciate over this past year the move toward coming back to the in-person, and I think you said you were updating the website as well. Has that been done so folks, when they look up where to go, they see they can come there directly?
Yes, thank you, Commissioner. The website has been updated.
Wonderful. There was a recent event where 6 teens just last week were rescued in my district, and led me to want to ask a little bit more about your data around youth who are sex trafficked. And this again can be follow up on page 79 of the budget book itself. You have some percentages in there. I'd be a little more interested to understand the number of youth that are being served in those programs and kind of what's feeding into those percentages. So understanding the denominator, but also the numerator for each of those race categories.
Thank you, Commissioner. I'll get that information for you.
Thank you. And I think it's so hard with the department. I think I got everything for this division, but if something else pops, I'll jump back in. Thank you.
Commissioner Brown Edwards.
Thanks for the presentation and for the work that is done to support families and residents in Multnomah County, lots of them in my district. I am going to a couple questions. On slide 54, the one-time only general fund programs that are not continuing, it has 128 for fair housing testing. I don't need this now, but I'm wondering if you could share the outcomes from last year. And I may then, once I see the outcomes, have a follow-up question, just because it seems like we don't have a problem anymore, or just less of a priority compared to other things is what I'm interested in.
Yes, there's still a challenge, but we had to make cuts, but we can get that data for you, Commissioner.
And I'm assuming, is that mostly in unincorporated areas?
It's East County. So it would include, I'll have to double check, but I presume it covers like the Corbett area.
Okay. Yes, it did. That was my budget amendment last year. That's correct, Lori.
Thank you, Commissioner.
So I guess what I would say is sort of my question is what the outcomes were last year. So I'm assuming the city of Portland has, and maybe the city of Gresham. So I'm curious about where are the gaps that might be left?
Yeah, it's typically East County. That's where the gaps are.
But not Gresham. Does Gresham have their own?
No, this is inclusive of Gresham.
Okay. Okay, I'd be interested in just the outcomes of that. Then, the gateway services. So in my role as the chair of the Local Public Safety Coordinating Commission, I heard from victim advocates the fact that the Gateway Center really will switch to virtual during the pandemic and is pretty much still virtual. There's a reference to adding a position and more consistent front door staffing. But I'm curious what that is, because what I've heard is the preference is in person versus virtual, or having to make an appointment to come in versus the system that was before, where the center was staffed and people could, go there when they needed it. So I'm curious. I say it's somewhat generalized that establish more consistent front door staffing. I don't need it right now, but will you send me what that means? And does that mean it's one day a week or a couple hours every morning? If somebody wants to answer now.
Yeah, I can answer that. Okay. So we actually have an FTE person that is there Monday through Friday, 9 to 4. So we didn't have that. We transferred somebody over from the DV crew side because they didn't need as much staffing. So It is, so the website was inaccurate. People can always come to the site. It's just that they want people to call because then they can make sure that there's staffing there. And there's a lot of on-site partnerships there. So probably on any given day, there's, at least, 10 to 15 people on site. So people are on site, and there's also a safety issue too, because sometimes survivors don't feel comfortable coming physically to the building, but we offer both of those options.
So just a clarification. So there's 10 to 15 people on site. So if somebody showed up at 8 o'clock in the morning or 6 o'clock at night or 7 o'clock, there's nobody on site?
No, there is a phone number that they can call, but they also have a workload that they, the reality is that probably 30% of the calls or people that ask for service, we simply don't have funding to help serve everyone. So there is a greater need, absolutely. If we could have 24-hour service, that would be amazing, but unfortunately, we don't have the funding.
What was, since I wasn't here pre-pandemic, what was the pre-pandemic staffing, just in terms of the hours of somebody arriving at Gateway?
I think can we get back to you on the comparison to pre-pandemic to now, and then just some of these other questions? And I think there's a lot of openness because Commissioner Singleton talked to us about our website not being clear, so we made those updates. They do have hours where anyone can show up, and then there's also a phone number listed, so we made that clarification because there was that confusion. I think our website did state to call. And so now it states both options. So I think we're moving towards making sure there's clarity around what's available, but we can do a comparison of pre-pandemic to now for you.
I'd also be, and this is something that could also be included in the follow-up, is whether you are working with victim advocate organizations to ask. So yes, some people may not want to come to the site, but is that what the preferred access point is? I'd be interested in knowing whether you've worked with the advocacy organizations.
So I just want to add a little more history to build on the question. So the Gateway Center, there was actually a different partnership with the City of Portland and where the work was actually housed. And I don't remember, and I'm sure, Laura, you remember this too, at some point the staffing and more of the budgeting came over to Multnomah County, and so that also, is part of the history of it, and I think has some impact in how much historical knowledge we have. But I think that's a good point to land. And I don't remember it ever being 24/7, though, is in terms of a facility.
Yeah, and I wasn't implying that. Just what I heard is like the people had reduced access to services because of there's just fewer on site, and it didn't shift back to sort of pre-pandemic levels of services. So I'd love to get follow-up on that. Then this is just a more general question about how all the budgets interact with each other, but this slide 60, again, I'm going to be focusing on sort of East Portland, East County. And this is economic stability, households served achieving stable housing, increased economic stability, avoiding eviction and homelessness. I'm curious, with all the shelters closing in East Portland, the proposed almost complete elimination of employment services through the county HSD, what impact that's going to have on economic stability. And again, it's so this is one slice from you all, but what I'm curious is the cumulative impact on East Portland and East County of the cuts, because the economic programs, there's, in addition to downtown, Old Town, there's a huge focus in East Portland of providing some sort of employment services, but also if you look at the shelters that are closing, many of them are in East Portland. Again, that's not necessarily a question for you, but I'm like one county, what's the impact on East Portland and East County? I have to ask a question about Sun Schools, because I'd be remiss not to, just knowing the value of Sun Schools to families and students in the county. I'm curious, I saw the list of the sites run by the city of Portland. When the county came up with a proposed set of reductions, which are all in PP, I believe in Portland Public Schools, did you all coordinate with the city of Portland about what they were going to propose keeping or reducing? It's interesting, I mean, just knowing Portland Public Schools so well, the list of what the city of Portland's funding and then what the county is funding. So to me, I'm looking at like Whitman, which is outer southeast, serves generally lower income families. And then I'm looking at the city of Portland list, and they've got, you know, Beaumont and Mount Tabor, which I love everybody having services, but I'm just curious because Mount Tabor would be much further down the list in terms of equity. So maybe somebody could speak to me about how that coordination happened.
Thank you, Commissioners. So yeah, as I mentioned, we worked with the school district, Portland Public School District. They had identified 12 schools based on the equity index, and of course 9 of which we selected. But we were also in partnership and continue to have multiple conversations with City of Portland, Parks Bureau, and our other school districts. So this was all very much made, I mean, obviously we had the final say, but it was done very collaboratively with our other partners, our other funding partners.
So my follow-up request, I'm sure we have this, is sort of the county map that has all of the county-funded sun sites, the city-funded sun sites, and then those that are slated to be closed, so that I can visually sort of see that again, looking at the sort of the geographic portion, because it sounded like Portland Public Schools and the county took into consideration that there are some percentage of SUN programs that are not being reduced, even though they're in higher income neighborhoods, because there still are families in need, and so they're serving a broader range. But I'm trying to visualize like what it is that's actually being, if you combine the city and the county reductions, what that would mean. Does that make sense?
Well, I don't think the city is not making any reductions.
Great, then it would be helpful to have all the county and all the city programs, and then I guess I can put them on the map where the ones proposed for reductions, but I'd like to see that larger map.
Yeah, and I think, and we can get that for you. And I would just say too that one of the goals was to not geographically concentrate the closure of schools in one particular area. So I know that that was a high priority for both PPS and for us, so that if one school closed over here, that it wasn't a desert over here, that youth and families could go to a nearby school. So I do know that that was a really big consideration.
Yeah, so that's why the map would be super helpful.
Yeah.
So that I can see that, and I think what I heard you say is the flexibility of, even if you don't, say if you're a Whitman student and had been participating in SUN programming, that you could then go to an adjacent school that still has.
Exactly, yeah. Yes.
And that's how the program will be set up, is it?
Well, we're hoping to, but as Rachel said, I mean, there's a lot of moving parts, but we want to work closely to see how we can accommodate those families who might be losing a site.
Yeah, nothing's been determined. Like those are conversations of like, how do we minimize impact when we're going to experience school closures? And we'll keep you posted on what we're able to sort out as we move through this.
Yeah, I mean, I would just think it's generally a good principle, since a lot of schools don't have it, and we know that every school almost has a percentage of kids who could use the services. Great, if I get that map, that would be helpful. I'm going to have some other just follow-up programs around program offer 30600, the employment programs. And also the is this where the reductions in the behavioral health gun violence response, is that in this program, or is that in, that's in the, in which?
Behavioral health.
Behavioral health, okay. And this is just a clarifying question. At the very beginning, Director Sigmund, I think you said that MSI change was more of a technical change?
No, that was the housing vouchers, the MSI. So that's kind of outside of it. Those families have housing vouchers, but those vouchers were in our budget, and now they've gone back to HSD.
So the vouchers just shifted places. It's the reduction. There's reductions elsewhere in the program. Okay, great. And like I say, I'll have some other follow-up questions. But for now, this is good. Thank you.
Great.
Appreciate
Just
it.
get them to Christian, and we'll make sure that they get shared out.
I got questions.
Absolutely.
Great. On the Sun School reductions, why did we choose to close sites versus reduce the level of, like, across the board reduction in services?
Well, there's one site manager per school, and then they also have other staff. So I think it's very challenging to have like half, but we can get you a more specific answer.
And why were providers told, principals told, before commissioners were told the site locations?
Why were principals told?
And the organizations that run the sites, why were they told before commissioners?
I can chime in there. I think, so this is very complicated just because we have a lot of partners. So I can't speak to the timing because that wasn't the intention, to not notify commissioners of the site closures before principals and partners. So I can own that we can look at sort of this timing of that in the future. I think we also knew that we needed to make sure that this site coordinator found out before community. So we had really tried to map out of respect of our partners and our partnerships with this work, to have an intentional communication plan. So we can certainly look at, timing and ensure that we make improvements to that as we're navigating what this potentially might look like in the future.
And then, and this could have been just a location-related determination, but it seemed as if some Sun School providers with multiple sites had no reductions, and two had a disproportionate, like, had the bulk of the reductions. Was that purely just based off of, like, bad luck of where they happened to be provider, or was that a decision based on provider outcome? Or I thought that was interesting to look at, and particular providers seem to be losing a large number of sites versus some providers losing none.
Yeah, I can tell you confidently it had nothing to do with provider outcomes, and we will get you the breakdown, because I know we've had conversations with Walter about the decision-making related, trying to look at overall impacts, because there's so many layers to this reduction of, like, provider, school community, equity index, which district is going to take the, those impacts, families. And so, it's really complicated, and I want to make sure that we get you the accurate information so we can get back to you on that.
Then when we look at Sun Schools often leverage multiple partners. One example was like the Portland Children's Levy. Although they don't fund sites, they'll fund programming within a Sun School. Have we looked into how much other funds are going to be lost due to our closures? Or maybe they'll be reallocated, maybe they'll be allocated to something un-Sun related.
Yes, we do have that information. We can get that for you.
Yeah, that'd be great. there was one other thing. On the, can I get the criteria for the 1115 housing voucher, just so that I can understand who's eligible? And then I know, my question, so I know that we have had issues with how quickly that's come in, and unfortunately, people have lost their housing due to that. So I really like the idea of having a pool that allows us to hopefully bridge that. Has there been conversation about, can we then get paid back into that pool when it is approved? Like, if somebody gets approved and it took 45 days or it took 60 days, but the application went in 60 days ago, can we get that pool reimbursed so that it's basically used as a bridge, more like presumptive eligibility and less like we're having to subsidize because another entity can't get their administration to move quickly enough? Have we had those conversations?
Oh, we've had so many conversations. I would say that I don't know the specifics on once the person is housed. I do know that the period where we have to put someone in a hotel would not be eligible, but it's possible that in our conversations that once they're in the same situation with the same landlord, that waiver would be attached to, that's possible. And I'm not sure, Miles is not here right now, but we will connect and find out the answer to that particular question, because it's a great one.
All right, great, thank you.
Yeah, I'll close this out. We met with the East County superintendents last week, and they were sharing just the overall impacts losing the family navigators, and they wanted to know through the SUN programs, how can they continue to have access to just rental assistance, and if that link is being made. And you can provide that in writing. You don't have to answer it now, but I just want to.
Just put your mic close.
You don't have to provide that answer in writing. Would you like me to restate the question? Okay. So we met with the East County superintendents last week, and they shared about the overall impacts of losing the family navigators as far as the reductions. And they wanted to know how can they gain access to rental assistance to some of the SUN students. Just wanted to know if there's been a conversation and where that link is being made. So you can just provide that
Okay,
in writing.
we'll get that information for you.
Yes, thank you. Outside of that, thank you.
Thank you. Okay, I think that's everything for.
That's one last question, sorry.
Yep, go ahead, and then we're going to close out.
So I'll just back to the SUN programs. Does the fact that it was a small school have an impact? Because I'm just looking at, two of the schools that kind of surprised me on the PPS list is Whitman and Vestal. Vestal's right on 82nd, serves lots of immigrant and refugee families. And I say Whitman is very diverse. And like Whitman has, even though it's 72 on ranking on the list, it has 72% of the families or 70% are BIPOC, which is actually higher than almost, with only a few exceptions, than all the other ones on the list. So I'm wondering, is it because they have a low student population?
So we can get back to you on that. I think, again, this is a partnership. This is a coordinated effort between multiple partners to get to the end result of the schools that are identified. So we'll just make sure that we connect with Walter and answer those questions for sure. Yeah. No, they're great questions. I think we just want to make sure we're giving you accurate.
I'm only seeing like 2 or 3 other schools that have a higher percentage, or maybe more than that, a handful.
Index is, there's multiple things. There's other resources in the school. There's a lot of factors that go into identification and in determining, what school community would be identified for reduction. And so I just want to make sure that we are giving you with those questions. So we'll capture those and make sure that we get back to you on all of the factors that sort of went into identifying. And I think it's just going to be, I also want to just say that we feel this for the, schools that are experiencing this reduction and the families and the kids. Like, this is such a meaningful resource for them, and I've, received hundreds of messages directly to me, and I feel every one of those and respond to every single one that writes to me directly, because I understand the impact that, this has, having 4 kids myself, and can only imagine the stress that families are under. So we certainly, want to make sure we get it as close to right, and it's not going to feel right. I also want to acknowledge it's not going to feel good, no matter what the outcome of this reduction ends up being.
Yeah, the reason I'm asking all those questions is, so of course we're getting asked by members of our community, like, explain the rationale why this one still is getting funded and this other school, the county is making the decision or proposing to cut this other program. And just to throw into with the Whitman Vestal, the other one is Creston, because they have the deaf and their demographics have changed over the years over the last 20 years. They used to be a Title I school, they're not anymore, but they do have the deaf and hard of hearing program. And I'm just curious whether that students in that program receive services and whether that was taken into consideration.
Thanks. And if you're going to be sending out information to the board, can you also, because I think the equity index was a big factor. I think it's also, though, important to know who's paying for which schools, like which ones we're funding, because there are some of them that may be higher on the equity index, but we're not funding them, and so that was a different entity's decision on funding it or not. So I think that's helpful information for the board to have too. Okay.
I want to make sure I understand that. So, for example, ERCO is at Vestal. You're saying that they may not have Sun schools because ERCO made the decision? And I'm just using that for illustration.
No, other funders. I'm talking about other funders, like Portland Parks or the school districts themselves. Like, we only can control the ones that we fund and make decisions about the one we fund.
Well, that's why I wanted to see sort of the whole map and then what ones we chose for reductions.
Yeah, that's why I asked to make sure that they included the funders in the sites. Okay, thank you so much. We're over a little bit on time. Just appreciate that. So I am going to ask PEL to come back on Thursday afternoon. Sorry. So you'll get your own special time. I think it's about 3 p.m. is when we are going to be having the follow-ups time. So with that, are there any amendments or budget notes this morning before we? Okay, there being no further business, we are adjourned.